So good afternoon, guys. Let people join in, then we'll begin. So offline classes are not possible as of now. So yeah, I hope all of you are studying well and yeah, maintain the pace. So I hope once people join in, then we can start. So if you have any questions in the session, you can just type it in the chat box here itself. Uh, I have started the YouTube live session on my mobile as well. Yeah, I can see your comments over there. Or apart from that, you can also type your questions in the WhatsApp group as well. It's better if you type it over here. Yeah. Thank you so much, तब ठीक है यार. Thank you. So let's begin with the session. I feel so. Okay. So yeah. जनरल तो हमने कर लिया था ऑलरेडी. सो सम पॉइंट्स दैट आर टू बी रिमेंबर्ड फ्रॉम जनरल प्लीज़ याद रख लेना क्या क्या इंपॉर्टेंट चीज़ है. आई ऑलरेडी टोल्ड यू कि एक तो कॉम्प्लिकेशंस जो है तुम्हारे ब्लड ट्रांसफ्यूजन के दैट कैन कम इन द क्वेश्चंस. ओके. देन कॉम्प्लिकेशंस ऑफ मैसिव बीटी. देन वुंड्स का क्लासिफिकेशन याद रख लेना, एटलीस्ट द सर्जिकल क्लासिफिकेशन दैट वी हैव. ओके. द सर्जिकल क्लासिफिकेशन दिस वन. देन फर्दर स्कार के दो टाइप्स याद रख लेना, इस पर क्वेश्चन पहले भी आ चुके हैं. बर्न्स इज़ अ वेरी इंपॉर्टेंट टॉपिक अकॉर्डिंग टू योर एग्जाम्स. ओके. सो प्लीज़ रिमेंबर all these that we have already discussed. The rule, Wallace's rule and Lund and Browder charts, please remember them. Apart from that, also this classification of burns, first, second, third degree and fourth degree burns. Then yeah, apart from this, the fluid management that we have, it is not only important over here but also important in pediatrics as well, in medicine as well. So please remember about that. Disaster management तो हमने already पढ़ लिया है. GCS याद रख लेना please यहाँ से. And then the most common ones, like the most common site of fracture or the most common sign that we have, pathognomic sign. Okay, all these are the questions that can appear in the exams. Yeah, these are some of them. सूचर्स के बस मैंने जो इंपॉर्टेंट वाले बताए, बस क्लासिफिकेशन याद रख लो, उससे ही मोस्टली तो उसी से चीज़ें आएंगी, बाकी इमेजेस से चीज़ें आने वाली है. इंस्ट्रूमेंट्स या आई कवर इट सेपरेटली इन द इमेजेस इटसेल्फ, डायरेक्टली इमेजेस में ही कवर कर लेंगे. देन सूचर्स में ये सूचर रिमूवल याद रख लेना, कौन से टाइम पे किसका होता है. नॉट्स याद रख लेना, नॉट्स की इमेजेस बता दूंगा. देन आर्टीरियल डिसऑर्डर्स में ऑलरेडी बता चुका हूँ. बर्जर्स डिसीज इज इंपॉर्टेंट, मेडिसिन से भी क्वेश्चन आ सकता है. दिस इज अ क्वेश्चन आर्टीरियल ऑब्स्ट्रक्शन का फ्रॉम सर्जरी इटसेल्फ. रेनॉल्ड्स, एज वी ऑल नो, इट हैज़ अपीयर्ड प्रीवियस ईयर वेल इन द एग्जाम्स. देन अन्यूरिज्म याद रख लेना, अन्यूरिज्म पे क्वेश्चंस थे पहले भी. अपार्ट फ्रॉम दिस डीवीटी इज इम्पॉर्टेंट. थायराइड एंड ब्रेस्ट आई हैव ऑलरेडी टोल्ड यू दे आर इम्पॉर्टेंट. तो थायराइड में जो कंजेनाइटल अनोमलीज थोड़ी बहुत है वो. कैंसर्स आर वेरी मच इम्पॉर्टेंट इन थायराइड एंड ब्रेस्ट एज वेल. ओके, प्लीज़ रिमेंबर एटलीस्ट हर बार एक क्वेश्चन तो आया ही है इधर थायराइड और ब्रेस्ट कैंसर से. सो प्लीज़ रिमेंबर दैट. yeah, these are some of the important questions. ये क्लासिफिकेशन, ये TNM स्टेजिंग जो ब्रेस्ट कैंसर की बताई थी, प्लीज़ रिमेंबर अबाउट दिस. एटलीस्ट ये T स्टेजिंग जो है, दैट इज T1 लेस देन 2, T2 2 to 5, T3 मोर देन 5 एंड T4A तुम्हारी चेस्ट वॉल, T4B your skin, T4C A and B, that is both of them, and T4D is your inflammatory cancer. Remember, inflammatory cancer has the worst prognosis. Okay, please remember this. Then I'll be starting with GIT, guys. Again, I'm telling, if any questions you can type in the chat box itself. Now moving further, embryology अगर हम GIT की देखें, so there are three parts from which the GIT develops. Okay, first is your foregut, second is your midgut and third is your hindgut. Okay, so foregut से क्या क्या develop होता है? So foregut develops into the esophagus until the ampulla of Vater. So D2 जो part है, okay, D2 में at the starting of D2 we have ampulla of Vater, as you all know. So foregut develops into esophagus till the ampulla of Vater. Then midgut develops from the second part of the duodenum to the 2/3 of the proximal transverse colon. So अगर ये तुम्हारे transverse colon है, ये तुम्हारा proximal 2/3 हुआ, so यहाँ तक तुम्हारा midgut होता है. Okay, so midgut develops from the second part of the duodenum D2 until the proximal 2/3 of your transverse colon, and lastly your hindgut develops from the distal 1/3 of your transverse colon until the rectum. Rectum में कहाँ तक? Until your dentate line. We'll be talking about dentate line in the rectum itself. Okay, it is important anatomically. Then talking about your first organ from GIT, that is your esophagus. As we all know, esophagus तुम्हें सबको पता है, fibromuscular tube. But the important one is this: the length of the esophagus was asked prior. अभी तो पूछे जाने की chances कम है, but then also remember the length of the esophagus is 25 centimeter. Okay, so remember the length of the esophagus is 25 centimeters. Which are other structures of GIT or kidney which have the same length? So remember, ureter as well as duodenum have the same length, that is 25 centimeters. So esophagus, ureters and duodenum are of the same length, which is, yes, 25 centimeter. Then I hope the internet connection is good. You can just increase the pixels, so if you can get a clear picture. Okay, so esophagus, ureter and duodenum have the same length, that is 25 centimeters. Then moving on to the site, so esophagus is located in your posterior mediastinum. So remember, where is your esophagus located? In your posterior mediastinum. Please remember this. Thymus is located in your anterior mediastinum. Please remember. Okay, and in your middle mediastinum is your heart. Okay, please remember this. Then talking about the constrictions that we have in the esophagus. Okay, so esophagus mein there is a confusion that there are 4 constrictions or 3 constrictions. So clearing it right over here. So there are 4 anatomical constrictions. Remember, anatomy की या surgery के हिसाब से जाएंगे तो there are 4 anatomical constrictions and 3 endoscopic constrictions. So अगर endoscope डालोगे तो तुम्हें 3 जगह narrowing मिलेगी. So that is not very much important, but these are very much important. That is your anatomical constrictions. So remember the 4 anatomical or surgical constrictions of esophagus. Okay, so remember, अगर पूछा गया कितने constrictions है esophagus में, then your answer would be 4. Remember this. Then the first constriction that we have is that it is at the pharyngoesophageal junction. Remember, okay, at the pharyngoesophageal junction is our first constriction. ठीक है, और वो कहाँ कौन से लेवल पे होता है? C6. Yes, the first constriction is at the pharyngoesophageal junction, जहाँ oropharynx and laryngopharynx and esophagus जहाँ connect करते हैं. At that point it is at which level? C6. Yes, and it is, और एक लैंडमार्क पूछा जाता है, it is 15 centimeters from the upper central incisors. Okay, ठीक है, upper central incisors से कितना है वो? 15 centimeters or 6 inches. Please remember. Moving further to second constriction, it is at the arc of aorta. जहाँ arc of aorta, ये तुम्हारा पहला constriction था. For example, this is your pharyngoesophageal junction. Second constriction जहाँ arc of aorta cross करता है esophagus को. Okay, so arc of aorta crosses the esophagus at which level? Yes, at T4. Remember, arc of aorta crosses esophagus at T4. So second constriction कहाँ होगा? T4 पे. शाबाश. So T4 पे second constriction है where the arc of aorta crosses the esophagus, and it is how much? It is 22.5 centimeters. Okay, it is 22.5 centimeters from the upper central incisors. Next, third constriction is at the crossing of your left main bronchus. So जहाँ पे तुम्हारी left main bronchus cross करती है esophagus को, at that level is your third constriction, and it is at which level? T5. ठीक है. So पहला constriction C6 पे, second constriction T4 पे, third constriction immediately at T5 where left main bronchus crosses the esophagus, and last is at the crus of diaphragm. ठीक है, जहाँ पे esophagus diaphragm में pass करेगी. Okay, at the crus of diaphragm or at the hiatus we can say, it is your last or the fourth constriction. और hiatus कौन सी level पे होता है? Esophageal hiatus is at the level of T10. Yes, Voice of America. So V goes for vena cava, which is at T8. ठीक है, then esophagus goes at T10, and lastly aorta goes at T12. शाबाश. So remember 4 constrictions of esophagus. First at the pharyngoesophageal junction, which is at the C6 level. Second, arc of aorta at T4 level, which is 22.5 centimeters from upper central incisors. Third is at the crossing of left main bronchus at T5 level or 27.5 centimeter from upper central incisors, and lastly the crus of diaphragm T10 level पे which is 40 centimeters from the upper central incisors. ठीक है, please remember this. Then sphincters कितने होते हैं esophagus में? There are two sphincters, ठीक है, upper sphincter and your lower esophageal sphincter. So remember please guys, so upper sphincter जो होता है it is your anatomical sphincter. Upper sphincter is known as your anatomical or cricopharyngeal sphincter. So upper sphincter is known as anatomical or cricopharyngeal sphincter, whereas your lower sphincter is known as physiological sphincter. Lower sphincter को क्या बोलोगे? Physiological sphincter. ठीक है, please remember the lower sphincter is very much important surgically. ठीक है, so the lower sphincter is how much in length? It is 3 to 5 centimeters in length. Lower esophageal sphincter LES बोलेंगे हम इसके बाद, it is 3 to 5 centimeters in length. Pressure important है. Normal lower esophageal sphincter pressure कितना होता है? It is 10 to 25 mm of mercury. You will understand it afterwards. क्यों important है ये pressure? Okay, so remember LES का normal pressure कितना होता है? 10 to 25 mm of Hg. Remember. Then there are four structures which contribute to the LES tone या LES pressure. ठीक है, तो जो LES tone है, लोअर एसोफेजियल स्फिंक्टर की जो टोन है या जो ये प्रेशर है, ये मेंटेन करने के लिए हमें चार कॉन्ट्रीब्यूशंस की जरूरत पड़ती है. द फर्स्ट इज योर इंट्रा अब्डोमिनल ईसोफेगस. सो जो अब्डोमेन में डायफ्राम के नीचे जो ईसोफेगस का पार्ट होता है, इट इज अप्रोक्सीमेटली 3 to 5 सेंटीमीटर्स. सो ये वाला इंट्रा अब्डोमिनल ईसोफेगस फर्स्ट. Second is your crus of diaphragm. So ये जो crus of diaphragm है, it has a pinch cock like action on the diaphragm. ठीक है, please remember this. Then next is your rosette arrangement of cardia. Okay, जो cardia तुम्हारा arranged होता है ना in rosette like fashion, that. And lastly is your angle of Hess. So what is angle of Hess? This angle of Hess is between the cardia and the esophagus. So ये gastroesophageal angle जो है, it is known as your angle of Hess. So remember the four factors which contribute to the LES tone. First was your intra-abdominal esophagus. Second is your crus of diaphragm. Third is your rosette arrangement of the cardia. And fourth is your angle of Hess. Please remember this. Okay, ये चार factors है जो contribute करते हैं LES की tone maintain करने में. Then moving on to the congenital anomalies of esophagus. This is important one which has come earlier. That is your esophageal atresia and tracheoesophageal fistula. इस पे questions आ चुके हैं पहले भी. So remember there are totally 5 types A to E. ठीक है, so you need to remember the most common type. So the most common type of esophageal atresia with tracheoesophageal fistula is type C. Remember please. Okay, कौन सा type है? Type C. So सबसे पहले तो esophageal atresia मतलब क्या? The esophagus is not formed. ठीक है, esophagus develop ही नहीं हो पाई है because the cavitation has not developed properly. Okay, ये एक tube normally ये एक mass था बस which had to be cavitated. इसमें cavity form होनी थी, but ये cavity थोड़ी form हुई and then it did not form further and that led to this esophageal atresia. ठीक है, and tracheoesophageal fistula क्यों develop हुआ? So this is your trachea, ठीक है, and this is your esophagus. So दोनों के बीच में एक septum होती है. Okay, a tracheoesophageal septum. If this tracheoesophageal septum is not formed properly, then this leads to an abnormal connection. Okay, a two-way abnormal connection. Fistula क्या होता है? दोनों तरफ से ओपनिंग होती है. ओके, सो अ टू वे abnormal connection is known as fistula which develops between the esophagus and your trachea. So this is what is known as your fistula. ठीक है, so ये reasons है तुम्हारे esophageal atresia and tracheoesophageal fistula के. Moving further, most common type I've already told you, it is type C. तो type C में क्या होता है? The upper esophagus is blind whereas the lower esophagus it communicates with your ट्रेकिया. ओके, ठीक है, सो लोअर इसोफेगस क्या करेगी? एक फेस्टुला बनाएगी. किसके साथ? ट्रेकिया के साथ. सो दिस इज योर, सो अपर इसोफेगस इज ब्लाइंड एंड लोअर इसोफेगस कम्युनिकेट्स विथ योर ट्रेकिया. सो दिस इज टाइप सी विच इज द मोस्ट कॉमन टाइप ऑफ ट्रेकियोएसोफेजियल फेस्टुला. प्लीज रिमेंबर, मोस्ट कॉमन कौन सा है? टाइप सी, वेयर द अपर इसोफेगस इज ब्लाइंड एंड लोअर इसोफेगस कम्युनिकेट्स विथ ट्रेकिया. प्लीज रिमेंबर. मूविंग फर्दर, सेकेंड मोस्ट कॉमन टाइप कौन सा है? एच टाइप. ओके, एच टाइप मतलब क्या? सो अपर इसोफेगस एंड ये लोअर इसोफेगस तुम्हारी, और दोनों भी ट्रेकिया के साथ कम्युनिकेट करती है. प्लीज रिमेंबर. ओके, बोथ ऑफ देम हैव एन abnormal connection with the trachea and this is what is your H type of fistula where both the ends communicate with trachea. So most common is type C. Okay, upper esophagus blind, lower esophagus communicates with trachea. And second most common type is type H. Okay, remember. Then vectoral are the anomalies. Vectoral, what are the vectoral anomalies which are associated with esophageal atresia? So vectoral anomalies, V क्या होता है इसमें? Vertebral. A for anorectal. C for cardiac, T for tracheal, R for renal, E for esophageal and L for limb defects. So ये बाकी के defects भी associated हो सकते हैं. So whenever you come across a question जहाँ पे बात हो रही होगी maybe esophageal atresia की, all these anomalies can also be given in the question itself. ठीक है? So इस तरह से, इसीलिए याद रखना important है. So vectoral are the anomalies which are associated with esophageal atresia. Okay, please remember. Then how can you diagnose esophageal atresia or how can you suspect esophageal atresia in case of pregnancy? Antenatally कैसे suspect करोगे कि हाँ भैया इस बच्चे में शायद sorry, इस बच्चे में शायद esophageal atresia हो सकता है. So you do a ultrasound. ठीक है, जब ultrasound करते हो what you will suspect is your anybody polyhydramnios. ठीक है, सो अल्ट्रासाउंड पे क्या देखने को मिलेगा तुम्हें? पॉलीहाइड्रामियस, बिकॉज जितना भी सलाइवा बन रहा है, ओके, और द एमनियोटिक फ्लूइड जो भी नॉर्मली बच्चा स्वेलो कर जाता है, दैट इज नॉट बीइंग स्वेलोड, व्हिच इंक्रीजेस द लेवल ऑफ एमनियोटिक फ्लूइड. ओके, लाइकर की लेवल बढ़ जाती है, एंड देयरफॉर ऑन अल्ट्रासाउंड यू कैन सी पॉलीहाइड्रामियस. यस, पॉलीहाइड्रामियस, राइट मनोज. देन प्लीज रिमेंबर दिस. देन द मोस्ट कॉमन क्लिनिकल पिक्चर क्या होगा? क्लिनिकल पिक्चर मोस्ट कॉमन कैसे प्रेजेंट करेगा? एक तो सबसे पहले ये क्या होगा? एक न्यूनेट होगा. ओके, अ न्यूनेट इज प्रेजेंटिंग टू यू इटसेल्फ ऑन द फर्स्ट और सेकंड डे ऑफ लाइफ. ओके, सो न्यूनेट इमीडिएटली आफ्टर बर्थ भी तुम डायग्नोज कर सकते हो अगर यू आर लाइक दैट इंटेलिजेंट. सो मोस्ट कॉमन क्लिनिकल पिक्चर क्या होगा? देयर इज कंटिन्यूअस ड्रूलिंग ऑफ सलाइवा फ्रॉम द माउथ. ओके, यस, नहीं. I'm asking guys about not the complication. I'm asking about the most common clinical picture which the neonate will present with. So यहाँ क्या होगा? Drooling of saliva, continuously saliva मुंह से बाहर आ रहा होगा, because the patient, the child is not able to swallow the saliva, right? So continuously जो भी saliva बन रहा है, it is drooling out of the mouth. Okay, continuous drooling of saliva from the neonate's mouth. So ये होगा तुम्हारा clinical picture. Then what will be your bedside test? Immediately क्या test करोगे? सबसे पहले yes, your bedside test would be passing a nasogastric tube. Pass a nasogastric tube. ठीक है, so एक nasogastric tube pass करो, and what you will see if you perform a X-ray, if you take a X-ray after passing a nasogastric tube, so तुम्हें क्या दिखेगा? एक blind end of esophagus है, and जहाँ पे ये पूरा nasogastric tube coiled है. So coiling of nasogastric tube is seen. Okay, or you can just without a X-ray also you can just feel the resistance. ठीक है, एक resistance आएगा, nasogastric tube further pass नहीं होगी, and coiling लगेगा, coiling हो जाएगा nasogastric tube का. Okay, so for confirmation कि nasogastric tube coil हुई या नहीं, you need to perform an X-ray. Please remember. So bedside test अगर पूछी गई, it is just passing a nasogastric tube. And treatment क्या करोगे? दो ends है, दोनों end blind है, तो अब क्या करना है हमें? Yes, X-ray पे और एक फीचर दिखेगा तुम्हें, that is stomach would be distended. Okay, stomach is distended with gas. तुम्हें लगेगा stomach collapsed है, तो नहीं, stomach is distended with gas. Please remember. ठीक है, it is a cavity, it would be distended with gas. Then further treatment क्या होगी? दो ends blind है, तो तुम्हें जो बस join करने हैं, right? So the treatment is only esophageal anastomosis. बस दो ends को join करना है, that's it. Okay, then moving further with your next type of atresia, which is your duodenal atresia. Yes, esophagostomy. Yeah, esophagostomy. Okay, creating joining both the ends of the esophagus together. Now moving further, that is duodenal atresia. ठीक है, जहाँ duodenum ढंग से properly develop नहीं हो पाई है. And duodenum कब नहीं develop होगी? I've already told you. Foregut कब तक होती है? Foregut is till the level of D1. Yes, till the ampulla of Vater. एंड उसके आगे क्या आ जाती है? मिडगट आ जाती है. ठीक है, फोरगट टिल D1 एंड मिडगट फ्रॉम D2. सो अगर फोरगट एंड मिडगट ये दोनों प्रॉपरली अगर फ्यूज नहीं हो पाते, देन देयर इज नो कनेक्शन बिटवीन फर्स्ट एंड सेकेंड पार्ट ऑफ duodenum and this leads to duodenal atresia. Please remember. ठीक है, so failure of fusion of the foregut and the midgut will cause duodenal atresia. Please remember. The most common cause of intestinal obstruction in newborns is what? Yes, it is your duodenal atresia. So अगर पूछा जाता है the most common cause of intestinal obstruction in newborns, तो आंसर क्या होगा तुम्हारा? Duodenal atresia. Please remember, अगर intestinal obstruction की most common cause पूछी गई in neonates, it is duodenal atresia. Most common GI anomaly associated with Downs is also duodenal atresia. So अगर Downs का child दिया गया है, उसमें अगर पूछा गया है the most common GI anomaly which can be seen, it is again your duodenal atresia. So याद रख लो, duodenal atresia is very common intestinal pathology, ठीक है, in Downs also and in normal neonates also. Then moving further, clinical picture क्या होगा? There would be a bilious vomiting. कैसी vomiting होगी? bilious vomiting होगी. Okay, so as we know, ampule of Vater पहले open हो रहा है, so bile duct वगैरह सब पहले open होगा, so bile is coming. Okay, so जब भी vomiting करेगा ये बच्चा, so there would be bilious vomiting, that is a yellowish bile mixed vomiting. ठीक है, bilious vomiting होगी, for very characteristic feature. Okay, so you need to differentiate it from the CHPS. I'll talk about it further. So याद रखना, duodenal atresia में there is bilious vomiting, whereas in CHPS there is non-bilious vomiting. Just remember this. Moving further, तुम सबसे पहला investigation क्या करोगे? You will just perform a X-ray abdomen. Yes, and X-ray abdomen पे क्या sign दिखेगा तुम्हें? On X-ray abdomen you will see characteristic. Anybody? Characteristic sign on X-ray abdomen in cases of duodenal. Yes, Vaishali, right, it is your double bubble sign. Yes, you can see your double bubble sign. दो bubbles दिखेंगे, एक तुम्हारा stomach and दूसरा तुम्हारा proximal part of duodenum. ठीक है, so you will see a double bubble sign. Triple bubble sign is seen in cases of jejunal atresia. Yes, and multiple bubble sign is seen in cases of ileal atresia. ठीक है, so triple bubble in jejunal atresia and multiple bubble in ileal atresia. Yeah, shabash. Then moving further, treatment of choice क्या करोगे? बस so दो duodenum के जो ends है उनको बस जोड़ दो, that is your duodenal anastomosis या फिर duodenostomy. I've already told you, अगर तुम किसी दो चीज़ों को जोड़ रहे हो that is stomy. ठीक है, अगर तुम बस ओपन करके छोड़ रहे हो that is stomy, that is opening. Okay, याद रख लेना, अगर बस ओपन करके छोड़ा है that is stomy. Please remember this. Then moving further to your annular pancreas. So same clinical picture के साथ mostly तुम्हें और एक डिसीज प्रेजेंट हो सकता है neonates again, that is your annular pancreas. Annular का मतलब क्या होता है? एक ring shaped. Okay, ring shaped of pancreas. So जो pancreatic tissue है, ये तुम्हारी for example duodenum है, so this pancreatic tissue will wound around the duodenum. ठीक है, and it will cause the blockage. Okay, so it will present same as duodenal atresia, so please don't confuse it with duodenal atresia. Okay, so annular pancreas will have the same clinical picture. Okay, it is a ring shaped pancreas. To confirm it, apart from X-ray, you need to perform a CT scan also sometimes, and the treatment of choice is your duodenostomy again, or duodenojejunostomy. Okay, please remember this. Then moving further is your CHPS, that is your congenital hypertrophic pyloric stenosis. So इसके बारे में characteristic कुछ features होंगे, जो भी तुम्हारा केस होगा उसमें characteristically क्या present होगा? एक first male child. Okay, so the couple who have a first male child, there is high suspicion कि उनमें उस बच्चे में CHPS हो सकता है. ठीक है, so first male child में होगा CHPS more commonly. Okay, इसमें 4 याद रख लो बस. So it is 1 in 4,000 live births. Okay, so incidence क्या है इसका? 1 in 4,000 live births. And second 4 क्या है इसका? 4th week में it presents. Okay, so around you can say 2 to 6 weeks. Okay, so 2 to 6 weeks of postnatal life. On an average, it presents mainly in your 4th week. Okay, so remember 1 in 4,000 live births and 4th week का presentation है, mainly in your male child. Please remember. Present कैसे करेगा? With non-bilious vomiting. I have already told you. यहाँ पे क्या होगा अभी? नॉन बिलियस वॉमिटिंग, क्योंकि पैथोलॉजी क्या है एक्चुअली यहाँ पे? वी हैव ऑलरेडी डिस्कस अबाउट CHPS अर्लियर. सो क्या होता है यहाँ पे? ये तुम्हारा स्टमक है, सो द पाइलोरस, द पाइलोरिक मस्कुलेचर जो है वो हाइपरट्रॉफिड हो जाता है, एंड ये हाइपरट्रॉफी होने की वजह से देयर इज नैरोइंग एट द पाइलोरिक कैनाल. Okay, which leads to this obstruction. So congenital hypertrophic pyloric stenosis is nothing but hypertrophic hypertrophied pyloric musculature. ठीक है, सो ये प्रॉब्लम है यहाँ पे. सो अगर बस यहाँ से रिगर्गिटेशन होगा, यहाँ से वॉमिटिंग होगी, सो बाइल मिक्स हो पाएगी क्या? नहीं. सो रिमेंबर इन CHPS देयर इज नॉन बिलियस वॉमिटिंग एंड इन duodenal atresia देयर इज बिलियस वॉमिटिंग. प्लीज रिमेंबर, ये डिफरेंशिएटिंग फीचर हो सकता है. देन second thing that you can see is on palpation. Okay, maybe in question बताया होगा तुम्हें. On palpation there is a olive shaped lump. Okay, एक olive shaped lump you can feel in the upper abdomen. Okay, so that may be described in the question. Okay, olive shaped lump, please remember, olive shaped lump. And sausage shaped lump, anybody कहाँ दिखता है sausage shaped lump? Sausage shaped lump is seen in anybody? Yes, it is seen in intussusception. It is seen in intussusception. Please remember, with jelly, red currant jelly stools. Okay, remember this. Now moving further. इसमें क्या क्या था? नॉन बिलियस वॉमिटिंग हो रही है बच्चे को, ऑलिव शेप्ड लंप है. द नेक्स्ट फीचर, इस पे क्वेश्चन आ चुका है पहले भी, दैट इज योर पैराडॉक्सिकल एसिड्यूरिया. सबसे पहले तो इस पे, जिसमें अगस्त पे क्वेश्चन आया था, दैट इज हाइपोकलेमिक, हाइपोक्लोरेमिक, मेटाबॉलिक अल्कलोसिस. प्लीज रिमेंबर. ओके, क्या क्या हो रहा है यहाँ पे? वॉमिटिंग हो रही है, ठीक है. सो वॉमिटिंग हो रही है तो उसकी वजह से क्या हो रहा है? स्टमक में से एसिड लॉस हो रहा है. एसिड लॉस होगा मतलब क्या हो गया? मेटाबॉलिक अल्कलोसिस हो गया, बराबर. सो रिमेंबर दिस. एंड सो व्हेनेवर देयर इज मतलब क्लोराइड भी लॉस होता है अलॉन्ग विद द HCl. सो HCl जो जाता है तो H प्लस आयन जाते हैं एंड क्लोराइड आयन जाते हैं. सो देयर इज हाइपोक्लोरेमिया ऑल्सो. ओके, सो व्हाई दिस हाइपोकलेमिया अकर्स? सो याद रखना, सबसे पहले तो क्या हो रहा है? डिहाइड्रेशन हो रहा है इन दिस चाइल्ड. ओके, देयर इज डिहाइड्रेशन. सो जब भी डिहाइड्रेशन होता है, बॉडी क्या करती है? कंपेंसेट करती है एंड इट रीअब्सॉर्ब्स व्हाट? यस, इट विल रीअब्सॉर्ब वाटर. बट हमने पहले भी देख चुके हैं, वाटर इज नॉट रीअब्सॉर्ब्ड अलोन. पानी कभी अकेला नहीं आता. पानी के साथ कौन आता है? ओके, यस, पानी इज ऑलवेज, सो वाटर इज ऑलवेज अकम्पनीड बाय सोडियम. प्लीज रिमेंबर. सो बॉडी क्या करना शुरू कर देती है? सोडियम रिटेंशन. सो सोडियम एंड वाटर रिटेंशन स्टार्ट्स फॉर कंपेंसेटिंग द डिहाइड्रेशन. एंड जैसे ही सोडियम एंड वाटर रिटेंशन स्टार्ट हो जाता है बॉडी में, सो व्हाट हैपेंस? बॉडी को हमें पता है, सोडियम अगर अंदर लेगी तो सिक्रीट क्या करेगी? पोटेशियम. यस, पोटेशियम एंड H plus secretion starts. Okay, so potassium and H plus are secreted out from the body. They are excreted out from the body, and which leads to this. Okay, which leads to hypokalemia. So potassium loss हो रहा है तो क्या होगा? Hypokalemia. And again H plus loss हो रहा है मतलब it leads to metabolic alkalosis, and secondly it leads to aciduria. H plus अगर यूरिन में जा रहा है, it means aciduria. सो पैराडॉक्सिकल क्यों बोलते हैं? नॉर्मली बॉडी इज इन मेटाबॉलिक अल्कलोसिस, राइट. बॉडी किस में है? मेटाबॉलिक अल्कलोसिस में है. तो उसके अकॉर्डिंग क्या होना चाहिए? नॉर्मली यूरिन में अल्कली सिक्रीट आउट होनी चाहिए. बट अल्कली सिक्रीट आउट हो रही है क्या? बाइकार्बोनेट्स? नहीं, रादर दे आर बीइंग रीअब्सॉर्ब्ड. एंड क्या सिक्रीट आउट हो रहा है? रादर H प्लस. तो ये उल्टा फिनोमिना चल रहा है. मैंने हमेशा बोला है, जो उल्टा चलता है दैट इज पैराडॉक्सिकल. ठीक है, सो रिमेंबर, ये उल्टा चल रहा है, इसीलिए इट इज पैराडॉक्सिकल एसिड्यूरिया. So remember, in CHPS what happens is there is hypokalemic, hypochloremic, metabolic alkalosis along with paradoxical aciduria. अगर नहीं समझ में आ रहा है कॉन्सेप्ट, प्लीज रट लो ये चीज, बिकॉज इसी पे क्वेश्चन आया था. ओके, प्लीज रिमेंबर, हाइपोकलेमिक, हाइपोक्लोरेमिक, मेटाबॉलिक अल्कलोसिस. प्लीज रिमेंबर. ओके, देन फर्स्ट इन्वेस्टिगेशन ऑफ चॉइस क्या करोगे तुम इन केसेस ऑफ CHPS? पहला इन्वेस्टिगेशन सबसे पहले in a child it is always the ultrasound abdomen. Please remember, क्या करोगे तुम? olive shaped lump है तुम्हें palpation पे, okay, non bilious vomiting वगैरह है. So the first investigation you will perform is your ultrasound abdomen. Yes, USG abdomen is performed and you can confirm it on ultrasound abdomen. Okay, so there would be hypertrophic pyloric musculature. So treatment क्या करोगे? अगर hypertrophy है तो बस एक कट मारोगे, right? So open कर दोगे वो बस. So that is known as your Ramsted's pyloromyotomy. ये नाम याद रखना जरूरी है because they can confuse you with other names also. So please remember. So the treatment of choice for CHPS is Ramsted's pyloromyotomy. So जो pyloric musculature है उस पर कट मार दिया, open कर दिया उसको. So that is known as pyloromyotomy. So the treatment of choice for CHPS is what? Ramsted's pyloromyotomy. Please remember this. And investigation of choice that, or the first investigation कौन सा है? इट इज अल्ट्रासाउंड अब्डोमेन. प्लीज रिमेंबर. ओके, देन मूविंग फर्दर, जस्ट अ मिनट गाइस, आई एम जस्ट नॉट श्योर व्हाट हैपेंड. Now moving further, esophageal trauma. ये छोटे छोटे टॉपिक्स है जो बस हम ऑन द वे कवर करते जाएंगे, ओके, which can appear sometimes. So remember esophageal trauma, first cause of esophageal trauma is your foreign body. ठीक है, पहली cause क्या है तुम्हारी esophageal trauma की is your foreign body. The most common site of impaction of foreign body कहाँ अटकती है? mainly near the cricopharynx. So remember narrowest part of esophagus कौन सा है तुम्हारा? cricopharynx. So narrowest part of esophagus, ये first constriction कहाँ आता है? cricopharynx पे. कौन सी level पे था ये? anybody? cricopharynx was at which level? It was at C6 level. Please remember, it was at C6 level, okay, or 15 centimeters from the upper central incisors. So that is the most common site of, yes, it is the most common site of foreign body impaction. Now, most common foreign body which is impacted in children. Anybody? Please answer it. Most common foreign body which is impacted in children is, yes, it is coin. So remember, the most common foreign body which is impacted in children is coin. The most common foreign body which is impacted in adults is your food material. ठीक है, so कोई भी food material, mainly it is your fish bone or another bones, okay, so meat bones वगैरह. So most common foreign body in adults is your food material, and most common foreign body in elderly is your dentures. ठीक है, जो बत्तीसी लगाते हैं ना, dentures या फिर loose teeth जो भी होंगे, ओके, सो दैट आर द मोस्ट कॉमन फॉरेन बॉडी इन एल्डरली. सो एल्डरली में पूछा गया तो डेंचर्स और लूज टीथ. अडल्ट्स में पूछा गया तो इट इज योर फूड मटेरियल, एंड अगर चिल्ड्रन में पूछा गया इट इज योर कॉइन. प्लीज रिमेंबर, ओके. देन ट्रीटमेंट क्या होगा इसमें? इफ द पेशेंट प्रेजेंट्स टू यू नॉर्मली विदाउट एनी चोकिंग सेंसेशन, तो बस क्या करोगे तुम? कंजर्वेटिव मैनेजमेंट करोगे. क्या करोगे? बस कंजर्वेटिव मैनेजमेंट. कंजर्वेटिव मैनेजमेंट में क्या करोगे? यू विल जस्ट एनकरेज मेशी फूड्स. ठीक है, क्या दोगे तुम पेशेंट को? मेशी फूड्स लाइक बनाना, जेली, ये वो बोलोगे वो खाओ. सो अलॉन्ग विथ मेशी फूड वो निकल जाएगा बाहर. ठीक है, सो एनकरेज मेशी फूड्स फॉर कंजर्वेटिव मैनेजमेंट इफ देयर इज नो चोकिंग सेंसेशन. बट इफ देयर इज चोकिंग सेंसेशन एसोसिएटेड, इफ देयर इज चोकिंग सेंसेशन, क्या कर लोगे तुम? Immediate endoscopic removal. Okay, if there is choking sensation, you can perform a immediate endoscopic removal. Yes, if you do not have endoscopy option with you at that particular point of time, you can also perform Heimlich's maneuver. Yes, you can also perform Heimlich's maneuver, but better option is always endoscopy. Okay, so remember, अगर choice में endoscopy होगा, please mark endoscopic removal. अगर नहीं होगा, then mark Heimlich's maneuver. Please remember. Then moving further to your esophageal perforation. ठीक है, esophageal perforation की most common cause क्या है? Iatrogenic. What is iatrogenic? It is due to doctor's mistake or due to healthcare professionals mistake. So most common cause of esophageal perforation is iatrogenic. और iatrogenic कैसे होगा? It is it is due to endoscopy. So remember, whenever you use rigid endoscopes, okay, जब rigid endoscopes use करते हो, they can lead to esophageal perforation. The most common site would be upper GI tract, that is your esophagus, upper esophagus mainly, okay. And treatment क्या करोगे? Conservative. Okay, so remember, suturing, ये वो options में मैंने question डाला था. So suturing वगैरह is not the option, okay, it is not the answer. So बस esophageal perforation में what you need to perform is conservative management. Conservative management में क्या करोगे? You will just leave a nasogastric tube, okay. So you will leave a nasogastric tube for up to 5 to 7 days until it spontaneously resolves, okay. ठीक है, ये अपना perforation अपने आप खुद resolve हो जाएगा. You need not perform any kind of suturing or any other stuff, okay. So please remember, esophageal perforation अगर question आता है, management is conservative. और conservative management में क्या करोगे? You will leave a nasogastric tube for up to 5 to 7 days. Please remember this. Now moving further to esophageal rupture. Esophageal rupture, it is due to barotrauma. Barotrauma मतलब क्या? Excessive pressure की वजह से, okay. So excessive pressure कब होगा? Due to excessive vomiting, okay. Vomiting या retching. Retching मतलब feeling like vomiting, okay. So excessive vomiting episodes या retching episodes जब होंगे, तो there is excess pressure on the esophagus which can lead to esophageal rupture. ठीक है, ये spontaneous rupture होगा. Then it is more common in whom? It is more common in alcoholics and elderly. Why I am talking about this? Because question में mention किया जाएगा okay, an alcoholic or an elderly with repeated vomiting episodes now presents with this symptoms, okay. So mostly mediastinitis के symptoms हो सकता है, okay, respiratory distress वगैरह हो सकता है. So please remember all these symptoms the patient will present with, and the patient would most commonly would be a alcoholic or an elderly patient जो vomiting episodes के साथ present करेगा. मोस्ट कॉमन साइट क्या है रप्चर की? इट इज योर लेफ्ट लोअर पोस्ट्रोलैटरल वॉल. सो मोस्ट कॉमन साइट इज योर लेफ्ट साइड में लोअर पोस्ट्रोलैटरल वॉल, प्लीज रिमेंबर. देन यस, अगर अल्कोहलिक्स में होता है एंड देयर इज अ ट्रांसम्यूरल रप्चर, मतलब पूरा रप्चर हो जाता है इसोफेगस, देन इट इज नोन एज योर बोरहैव सिंड्रोम. यस, इट इज नोन एज योर बोरहैव सिंड्रोम, प्लीज रिमेंबर दिस. ओके, बोरहैव सिंड्रोम. और बोरहैव सिंड्रोम का ट्रायड क्या है? इट इज नोन एज मैकुलर ट्रायड. बोरहैव सिंड्रोम का ट्रायड इज नोन एज मैकुलर ट्रायड. सो तीन चीजें क्या है इस ट्रायड में? फर्स्ट इज वॉमिटिंग एपिसोड शुड बी देयर. ओके, पहला चीज क्या होनी चाहिए? वॉमिटिंग एपिसोड्स हो या रेचिंग एपिसोड्स हो. सेकंड चीज चेस्ट पेन होना चाहिए. ओके, सो इट इज विच इज सजेस्टिव ऑफ मीडियास्टिनाइटिस. सो सेकंड इज योर चेस्ट पेन. ओके, एंड थर्ड इज योर सबक्यूटेनियस एम्फाइसीमा. और सबक्यूटेनियस एम्फाइसीमा कैसे डायग्नोज करोगे और या सस्पेक्ट करोगे? यू विल सस्पेक्ट इट if अगर on auscultation you can hear the mediastinal crunch. Auscultate जब करोगे पेशेंट को, you will feel a mediastinal crunch. So एक crunching sound आएगा. Okay, so it is also known as which sign? Anybody? It is also known as leather boot steps on snow. Okay, so snow पे जब leather boots पहन के जब चलोगे, उस टाइप का क्रंच जो आता है, that crunch would be heard on auscultation. So that is known as mediastinal crunch. Yes, it is known as Hammond's sign. It is also known as Hammond's sign. Please remember. So Hammond's sign या leather boot steps on snow या फिर mediastinal crunch. Okay, is the third thing, third component of macular striate, which is due to subcutaneous emphysema. Please remember. So तीन चीजें macular striate की. First is vomiting episode. Second is chest pain, and third is subcutaneous emphysema. And suspected by which sign? Hammond's sign. Then first investigation क्या करोगे? सबसे पहले obviously you will perform a chest X-ray. The first investigation handy सबसे क्या है याद रखना. पहले मैं सबसे पहले बता रहा हूँ, first investigation जो होता है that should be handy. Okay, अगर तुम पेशेंट की कंडीशन देखोगे, अगर पेशेंट हीमोडायनेमिकली स्टेबल है या अनस्टेबल है, उसके ऊपर तुम डिसाइड करोगे तो फर्स्ट इन्वेस्टिगेशन क्या होने वाला है. सो फर्स्ट इन्वेस्टिगेशन इज नॉट ऑलवेज डायग्नोस्टिक, इट इज जस्ट टू सस्पेक्ट एनीथिंग. ओके, सो रिमेंबर फर्स्ट इन्वेस्टिगेशन जो होगा वो बहुत प्रिलिमिनरी चीज होगी, जैसे कि चेस्ट एक्सरे हो गया, बेरियम स्वेलो हो गया कभी, या फिर अल्ट्रासाउंड हो गया. ओके, प्लीज रिमेंबर इन्वेस्टिगेशन ऑफ चॉइस इज समथिंग जो नॉन इन्वेजिव होगा मोस्ट ऑफ द टाइम्स. ओके, इन्वेस्टिगेशन ऑफ चॉइस हम प्रेफर करेंगे कि नॉन इन्वेजिव हो. ओके, याद रखना प्लीज. सो इन्वेजिव मेथड्स आर नॉट ऑलवेज द इन्वेस्टिगेशन ऑफ चॉइस. देन एंड गोल्ड स्टैंडर्ड या बेस्ट अगर पूछा जाए, गोल्ड स्टैंडर्ड या बेस्ट, सो वहाँ पे यू नीड नॉट थिंक अबाउट द प्रैक्टिकल पॉसिबिलिटी ऑफ दैट थिंग. ओके, सो वो कितना प्रैक्टिकली पॉसिबल है या नहीं है, दैट यू नीड नॉट थिंक अबाउट. या फिर तुम रेगुलरली परफॉर्म करते हो नहीं करते हो, नथिंग. बस बेस्ट इन्वेस्टिगेशन क्या है, तुम सबसे अच्छा किससे डायग्नोज कर सकते हो, दैट आर योर गोल्ड स्टैंडर्ड या बेस्ट. दे आर नॉट प्रैक्टिकली पॉसिबल ऑल्सो एट टाइम्स. ओके, बट इन्वेस्टिगेशन ऑफ चॉइस वो प्रैक्टिकली पॉसिबल भी होनी चाहिए, नॉन इन्वेजिव भी होनी चाहिए मोस्ट ऑफ द टाइम्स, एंड डायग्नोस्टिक भी होनी चाहिए. प्लीज रिमेंबर. Okay, so this is the thing when you think of investigation of choice. So investigation of choice यहाँ पे क्या करोगे? Just a CT scan. Yes, CT thorax is performed, and the treatment क्या होगा यहाँ पे? You will perform a thoracotomy. You will open the thorax. You will perform a thoracotomy and you will perform a thoracomediastinal lavage. ठीक है, एक thoracomediastinal lavage perform करोगे because there is gross contamination. So अगर gross contamination होगा, you will leave a drain also. You will leave a drainage tube also. But if there is minimal contamination, you need not leave a drainage tube. Okay, so remember, treatment of choice for esophageal rupture is thoracotomy along with thoracomediastinal lavage with or without drainage tube. Please remember. Moving further, ये क्वेश्चन बहुत बार आ चुका है गाइस, प्लीज रिमेंबर. इसमें एक तो तुम्हें एक्सरे दिया जाएगा, साइन पूछी जाएगी या डायरेक्टली साइन पूछी जाएगी एज अ वन लाइनर, क्राइटेरिया पूछा जा सकता है, ट्रीटमेंट पूछी जा सकती है, इन्वेस्टिगेशन ऑफ चॉइस पूछा जा सकता है. प्लीज रिमेंबर. ओके, सो प्लीज रिमेंबर अकलीजिया कार्डिया इज वेरी इंपॉर्टेंट टॉपिक. ओके, So remember, achalasia cardia में क्या होगा? There is absence of ganglion cell in which plexus? There are two nerve plexuses as we know in GIT, right? First is your myenteric nerve plexus, also known as Orbach's nerve plexus. Myenteric मतलब कहाँ होगा ये? Muscle में, right? And second is your Meissner's nerve plexus, which is located in your submucosa, right? So ये myenteric या muscular nerve plexus जो है तुम्हारा, उसमें ganglion cells absent होंगे, okay? And that leads to a constant spasm, okay? So जो lower esophageal sphincter होगा, that undergoes constant spasm, persistent spasm में होगा वो. Please remember, okay? So achalasia cardia diagnose करने के लिए there is a criteria, and that criteria is known as Chicago criteria. Please remember, for achalasia, which criteria we have? We have Chicago criteria. So Chicago criteria में तीन components होने जरूरी है. First is your non-relaxing lower esophageal sphincter. So जो LES होगा, that would be non-relaxing. ठीक है, it is in persistent spasm. Second criteria is LES का pressure should be more than 25 mm of Hg. So normal LES pressure कितना था? We have already seen. I have already told you. Please remember that. So normal LES pressure was 10 to 25 mm of Hg. So when it exceeds 25 mm of Hg, it can lead to achalasia cardia. And the third pathognomic feature, तीनों में से जो अगर pathognomic पूछा जाए, it is absent esophageal peristalsis. ठीक है? So अगर pathognomic feature पूछा जाए achalasia का, it is your absent esophageal peristalsis. So please remember, Chicago criteria is for which disease? Achalasia cardia. तीन components. पहला है तुम्हारा non-relaxing LES, मतलब persistent spasm of LES. Second है तुम्हारा LES pressure more than 25 mm of mercury. And third pathognomic feature है तुम्हारा absent esophageal peristalsis. Pathognomic feature है absent esophageal peristalsis. Please remember. Then primary हो सकता है achalasia या secondary हो सकता है. So primary, it does not have a known cause. Okay, so it is idiopathic. So primary की most common cause क्या है? Idiopathic. You do not know the cause. And secondary में there is some underlying pathology which has led to achalasia, and that underlying pathology can be, yes, it is your Chagas disease. Chagas disease is also known as anybody? Chagas disease is also known as American trypanosomiasis. Yes, it is known as American trypanosomiasis or American sleeping sickness. Please remember, it is due to which organism? It is due to Trypanosoma cruzi, and it is transmitted by American trypanosomiasis is transmitted by, important question, it is transmitted by reed-weed bug. Please remember, it is transmitted by reed-weed bug. Then moving further, other causes can be diabetic mellitus, diabetes mellitus neuropathy में हो सकता है, cancers में हो सकता है, या pseudotumors. What are pseudotumors? Which compress from outside. ठीक है, so अगर ये तुम्हारी esophagus है, इसको अगर बाहर से compress करोगे, LES would be in constant spasm, and that are your pseudotumors. Okay, please remember. So Chagas disease में याद रख लेना, there is mega esophagus, there is mega colon, all these mega would be associated with Chagas disease. Please remember. ठीक है. Then moving further, एज ग्रुप क्या है achalasia का? मोर कॉमनली, सो याद रखना, अगर achalasia का पेशेंट प्रेजेंट करेगा, मोर कॉमनली इट वुड बी इन विच एज ग्रुप? 25 to 40 years of age group, that is young adults में प्रेजेंट करेगा achalasia. So please remember, achalasia presents in young adults. Please remember, young adults में प्रेजेंट करेगा. कार्डिनल सिम्टम्स क्या होंगे? प्रेजेंटिंग सिम्टम्स, जो इंपॉर्टेंट प्रेजेंटिंग सिम्टम्स होंगे वो होंगे progressive dysphagia. So dysphagia is the difficulty in swallowing which is progressive. ठीक है, बढ़ता जा रहा है वो dysphagia, पहले कम था अभी बढ़ता जा रहा है, so that is known as progressive dysphagia. One more characteristic feature achalasia के dysphagia के बारे में, so remember this dysphagia is more for liquids as compared to solids. ठीक है, so this dysphagia is more for liquids. Why? Because liquids are lighter. Okay, so liquids cannot exert that much pressure on this lower esophageal sphincter, therefore they cannot pass easily. But solids can exert a pressure on the lower esophageal sphincter and they can pass easily. Therefore the dysphagia is progressive and it is more for liquids as compared to solids. Please remember, ये characteristic होगा achalasia के question में. Okay, dysphagia more for liquids. Then moving further, regurgitation तो होगा ही obviously. Okay, there is regurgitation, and this regurgitation can lead to the complication which is aspiration. Yes, aspiration pneumonitis हो सकता है. Please remember. Okay, so achalasia के patients में the complication is aspiration pneumonitis. Also, it can lead to squamous cell carcinoma due to constant irritation of the esophageal mucosa. ये esophageal mucosa का constant irritation होता रहेगा, which can lead to squamous cell carcinoma. The most common site for squamous cell carcinoma is anybody of esophagus? So CA esophagus में most common site is most common site of CA esophagus, guys. Yes, it is your middle 1/3. So remember, mid 1/3. Okay, अगर mid 1/3 option में नहीं है तो upper 2/3 is also option. But अगर mid 1/3 है, so that is the best option. So middle 1/3 is the most common site for squamous cell carcinoma. Please remember. First investigation that you will perform in achalasia is anybody? First investigation that you will perform is first investigation you perform in achalasia cardia is, yes, X-ray, but not X-ray alone. It is your barium swallow X-ray. Please remember. Okay, it is your barium swallow X-ray, because we need to perform an X-ray anytime. So better we perform a barium swallow X-ray. So first investigation of achalasia is your barium swallow X-ray, and very characteristic. Consi sign. Which sign is seen on barium swallow in achalasia? ये क्या दिख रहा है तुम्हें? This is your, yes, it is your bird beak sign. ठीक है, it is your bird beak or pencil tip sign. Please remember. So pencil tip or bird beak sign on a barium swallow is seen in achalasia cardia. Rat tail, guys, please remember, rat tail is not seen in achalasia. Please don't use it interchangeably. Bird beak and pencil tip are the signs of achalasia cardia, whereas rat tail is a sign of esophageal carcinoma. Please remember, rat tail क्यों different है? Because bird beak या फिर pencil tip sign जो है, the sides are very much clear, okay, but esophageal carcinoma में there is shaggy appearance. ठीक है, rat tail appearance जो होगा वो shaggy होगा. So like this, please remember. Okay, so don't use it interchangeably. Rat tail is only for esophageal cancer, whereas pencil tip or bird beak is for achalasia cardia. Then investigation of choice, anybody? Investigation of choice for achalasia cardia is your investigation of choice is your esophageal, yes, esophageal manometry. Please remember, investigation of choice for achalasia cardia is esophageal manometry. Manometry मतलब क्या? Pressure measure करोगे. So you will measure the esophageal LES pressure. Okay, so investigation of choice for achalasia is esophageal manometry, whereas the first investigation was barium swallow. Please remember, investigation of choice is different over here, esophageal manometry. Treatment क्या करोगे तुम? You will relieve the spasm, right? So treatment would be just smooth muscle relaxants like the drugs, calcium channel blockers. ठीक है, nifedipine वगैरह, diltiazem, nifedipine, all these drugs can be given, okay, to relieve the spasm. First. Second management क्या होगी? Pneumatic balloon dilatation. ठीक है, एक balloon डालोगे एंडोस्कोप के थ्रू and you will dilate that balloon properly. ठीक है, so you will inflate that balloon which would lead to dilatation of this lower esophageal sphincter. So second was your pneumatic balloon dilatation. Third is your POEMS. What is POEMS? POEMS is peroral endoscopic myotomy surgery. So endoscope डाल के तुम myotomy surgery perform करोगे. What is myotomy? Just opening a muscle. मतलब cut मारोगे बस एक muscle पे. Please remember. Okay, so POEMS करोगे. या फिर the treatment of choice if asked, treatment of choice is your Heller's cardiomyotomy. Question has been asked prior. Okay, so treatment of choice for achalasia cardia is Heller's cardiomyotomy along with fundoplication. अगर दोनों ऑप्शन में है, please remember it is better you mark Heller's cardiomyotomy along with fundoplication. ठीक है, अगर नहीं है, दोनों अलग अलग है ऑप्शन में, then Heller's cardiomyotomy is a better option to be marked. ठीक है, so please remember the treatment of choice for achalasia is Heller's cardiomyotomy along with fundoplication. और Ramsted's seromyotomy या Ramsted's pyloromyotomy किसके लिए था? It was for CHPS and Heller's is for achalasia cardia. Please remember, ये इसमें confuse कर सकते हैं तुम्हें. देन esophageal pressure, normal esophageal LES का प्रेशर कितना था 10 to 25 mm of mercury. Achalasia में कितना हो जाता है 25 to 100 mm of mercury. So esophageal manometry पे तुम अगर देखोगे, अगर LES का प्रेशर is 25 to 100 mm of Hg, it is achalasia cardia. If esophageal pressure is between 180 to 200 mm of Hg, it is nutcracker esophagus. 180 to 200 में it is nutcracker esophagus. And then next one is your diffuse esophageal spasm. Diffuse esophageal spasm में कितना होगा pressure 400 to 500 mm of mercury. So remember maximum pressure 400 to 500 किस में है DES में, 25 to 100 किस में है achalasia cardia में, और 180 to 200 किस में है nutcracker esophagus में. Please remember. Moving further to Zenker's diverticulum, already discussed many a times. So Zenker पहले DES का एक बस important point याद रख लो. Diffuse esophageal spasm में अगर तुम barium swallow perform करते हो, the sign which is seen, it is known as, the appearance of esophagus is, anybody, in diffuse esophageal spasm on barium swallow, the appearance would be, yes, it is corkscrew appearance. ठीक है, so उस तरह का कुछ appearance होगा. Please remember. So corkscrew appearance of esophagus is seen on diffuse esophageal spasm. Please remember, corkscrew appearance. Then moving further, Zenker's diverticulum. So Zenker's diverticulum, it is also known as cricopharyngeal achalasia. ठीक है, so it is also known as cricopharyngeal achalasia. So I have already explained you, there are three constrictor muscles in the pharynx, which is your superior constrictor, superior constrictor, middle constrictor, and your inferior constrictor. Inferior constrictor के दो fibers होता है, that is your thyropharyngeus fiber and your cricopharyngeus. So thyropharyngeus are oblique fibers and cricopharyngeal are circular fibers. और इन दोनों के बीच में एक space रह जाती है, and that is known as your triangular space, which is known as Killian's dehiscence. So please remember, the most common area जहाँ पे Zenker's diverticulum होगा, that is your Killian's triangle or Killian's dehiscence. Please remember. Okay, so Zenker's diverticulum is which type of diverticula? It is a false type of diverticula. It is a false diverticula. False diverticula मतलब it does not contain all the three layers. Okay, so बस एक या दो layers होंगे. ठीक है, so if the diverticula contains all the three layers, it is known as true diverticula. If it contains any मतलब it contains one or two layers only, then it is known as false diverticula. Please remember. And pulsion type होता है. What is pulsion type? Pulsion type मतलब due to abnormal peristalsis. जब abnormal peristalsis चलता है, there is push from the inside, जिसकी वजह से esophagus का diverticula बन जाता है via the Killian's dehiscence. Okay, remember. And अगर बाहर से कोई pull होगा, that is known as your traction type of diverticula. Please remember. So the most common area for Zenker's diverticulum is your Killian's dehiscence. In which muscle? In inferior constrictor muscle. Yes. So ये कैसे present करेगा? Mostly it is in which age group? I have already discussed. It is in elderly age group. Okay, around 60-70 years of age group, a person would present with dysphagia. Yes, and dysphagia would be again progressive. So ये भी dysphagia कैसा होगा? Progressive dysphagia होगा. Then there would be halitosis. Okay, halitosis is what? Bad breath होगी due to regurgitation of the previous day food items. ठीक है, so these are the three features. And elderly individual presenting with dysphagia, halitosis and regurgitation, it is very much suggestive of Zenker's diverticula. Then you can perform a Boyce sign. What is Boyce sign? Anybody? Boyce sign is when you apply pressure on the swelling. Okay, so the patient would present also with the swelling many a times, a midline swelling, and when you press that swelling, it leads to a gurgling sound. Okay, a gurgling sound on pressing the swelling is known as Boyce sign. Okay, Boyce sign is also seen in one ENT pathology. Anybody? Boyce sign, gurgling sound. It is also seen in, anybody? Boyce sign is seen in, yes, it is seen in your laryngocele. Please remember. Okay, it is also seen in laryngocele. When you compress or you press on the midline swelling or the lateral swelling, and you can hear the gurgling sound. The most common complication of Zenker's diverticulum, obviously, अगर regurgitation हो रहा है, the most common complication would be your aspiration pneumonitis, leading further to lung abscess. ठीक है, it can lead to lung abscess also. Investigation of choice for Zenker's diverticulum is your barium swallow. So please remember, अगर esophagus की बात आए तो barium swallow perform करोगे, अगर stomach की बात आए तो barium meal perform करोगे, अगर small intestine की बात आए तो barium meal follow through, and अगर colon की बात आए तो barium enema. So please remember, okay, for esophagus is barium swallow, stomach barium meal, small intestine barium meal follow through, and colon barium enema. Please remember. Then moving further, so investigation of choice for Zenker says barium swallow. Okay, और barium swallow पे एक outpouching दिखेगी posteriorly in the midline. Please remember, via the Killian's dehiscence. Treatment क्या करोगे? If there is a small Zenker's diverticulum, it varies. ठीक है, अगर small Zenker's diverticulum होगा, medium होगा या large होगा size में. So if it is a small Zenker's diverticulum, you will just perform a cricopharyngeal myotomy. So तुम बस ये cricopharyngeal myotomy opening create कर दोगे, cut मार दोगे cricopharyngeal muscle पे which will release the pressure. Okay, so you perform only a cricopharyngeal myotomy. Second is Dohleman's operation. What is Dohleman's operation? So Dohleman's operation में, so this is your outpouching. Okay, what you do is, ये तुम्हारी outpouching है, so you take the outpouching along with the esophagus and just staple it. Okay, so you staple it along with it. So that is known as Dohleman's operation. So linear stapler for the of the outpouching with the esophagus is known as your Dohleman's operation. Please remember. Then next is your diverticulopexy. Diverticulopexy का मतलब क्या होता है? Pexy मतलब fixing, याद रख लेना. Okay, pexy मतलब fixing. So ये जो तुम्हारा diverticula है, इसको बस ऊपर तुम टांग दोगे ऐसे. So okay, so please remember. You just suspend it from the above. Okay, so no food items are actually collected, no halitosis, no regurgitation, no dysphagia. ठीक है, so you just suspend it from the above, that is known as diverticulopexy. And lastly, अगर large होगा diverticula, then you just excise it. Okay, you just excise it, that is known as diverticulectomy. Then moving further is your GERD, that is your gastroesophageal reflux disease. और GERD कब होता है? When there is transient lower esophageal sphincter relaxation. ठीक है, so normally तुम्हारा अगर तुम्हारा peristalsis नहीं चल रहा होगा, your LES maintains its tone and it is in spasm, as we have already spoken about it. So LES is normally in spasm. ठीक है, but if there is transient for short duration of time, if there is LES relaxation, so it can lead to regurgitation. Okay, it can lead to regurgitation of the acid into your esophagus, which can lead to irritation. ठीक है, which can lead to heartburn, pyrosis. Okay, all these symptoms. So please remember, अगर transient LES sphincter relaxation होता है, it can lead to GERD. Risk factors would be, yes, you are smoking, alcohol, elderly, okay, NSAIDs intake, all this can be your risk factors. Please remember. Okay, then triad. The triad is very much important for GERD to remember. First is your retrosternal pain. So first feature क्या है? Retrosternal pain. Second is your epigastric pain, and third is your regurgitation. So retrosternal pain या retrosternal burn करके आ सकता है. Also it can be named, also it can be called as pyrosis. ठीक है, heartburn जो बोलते हैं हम. Second is your epigastric pain, and third is your regurgitation. So the three features of GERD: first is retrosternal pain, second is epigastric pain, and the third is regurgitation. Please remember. The first investigation that we perform in GERD is, the first investigation to be performed is your अपर GI endoscopy. तो सबसे पहले क्या परफॉर्म करोगे तुम? बस एंडोस्कोपी परफॉर्म करोगे. फर्स्ट इन्वेस्टिगेशन फॉर GERD performed is upper GI endoscopy. And what characteristic feature you can see is your cobblestone mucosa. So a chronic GERD can lead to a cobblestone mucosa. Please remember. I'll show you in the images itself. So this is what a cobblestone mucosa would look like. Okay, please remember. So cobblestone mucosa is seen in which cases? In cases of GERD on upper GI endoscopy. Please remember. The investigation of choice, but is not endoscopy. So the investigation of choice for GERD is what? Yes, it is 24-hour pH monitoring. 24-hour ambulatory pH monitoring. Ambulatory मतलब चलते फिरते. ठीक है. So a pH sensor is just placed Okay, so a 24-hour ambulatory pH monitoring is done, and according to it, a score is given, and that score of GERD is known as Johnson-Demister score. So please remember the name at least. Johnson-Demister scoring किसके लिए है? GERD के लिए. Which score we have? Johnson-Demister score. So according to Johnson-Demister score, ambulatory pH monitoring जब कर रहे हैं, esophageal pH पहले बता दो normal कितना होता है. Esophageal pH is normally 5 to 7. Okay, so normal esophageal pH is 5 to 7. Johnson-Demister score के according, अगर pH is around 4 for 4 times in 24 hours, okay, so that is diagnostic of GERD. अगर esophageal pH 4 record किया जाता है 4 times in a day, okay, 4 बार अगर तुम 4 के आसपास अगर pH record करते हो, 4 या 4 से कम, then that is diagnostic of GERD according to the Johnson-Demister score. Please remember. Treatment में क्या करोगे normally? First of all, you will just modify the lifestyle, that is quit smoking, quit alcohol वगैरह वगैरह वगैरह. ठीक है, so lifestyle modifications would be performed, but the treatment of choice if asked, treatment of choice क्या होगी? It is your proton pump inhibitor. Just you give proton pump inhibitors. But if asked surgical treatment of choice, या फिर अगर option में दिया हुआ है surgical treatment of choice, then you need to mark Nissen's fundoplication. So remember Nissen's 360 degree fundoplication. So fundoplication मतलब क्या होता है? ये जो fundus होता है, gastric fundus, it is pulled up and it is tied around the esophagus. So this is how your stomach would look like. So this is known as your fundoplication. ठीक है, so याद रख लेना, DOR is partial fundoplication which is 180 degree and Nissen's is complete fundoplication, that is 360 degree. Please remember, ये दो तो याद रख लेना. DOR is 180 degree performed in achalasia cardia. Nissen's is complete 360 degree performed in GERD. Please remember. Okay. Then moving further, complications of GERD क्या क्या होंगे? So most common complication, regurgitation होता रहता है, acid जा रहा है बार बार, so it leads to inflammation. So the most common complication of GERD if asked is esophagitis, just inflammation. Then it can further progress to बार बार irritation होता रहता है esophageal mucosa का, so it can lead to a cellular adaptation which is known as metaplasia. And normally esophageal mucosa कैसा होता है? Squamous. It turns into columnar. So this columnar metaplasia is known as Barrett's esophagus. Yes, it is known as Barrett's esophagus. Please remember. Okay, second complication. Then moving further, Barrett's esophagus is a pre-malignant condition which can develop into adenocarcinoma. Okay, so remember, normally esophageal cancer most common type कौन सा होता है? Squamous cell carcinoma. Most common site कौन सी होती है? Middle 1/3. Okay, but in cases of Barrett's esophagus, the most common cancer which is associated with Barrett's or GERD, it is your adenocarcinoma. ठीक है, columnar metaplasia हो रहा है, so it will develop into a adenocarcinoma and most common site would be your lower 1/3. Most common site कौन सी होगी? Lower 1/3. So अगर Barrett's के साथ पूछा गया तो it is adenocarcinoma. Most common site lower 1/3. Overall पूछा गया squamous cell carcinoma. Most common site middle 1/3. Please remember. Then उसके बाद क्या होगा? Long time पे esophageal shortening होगी and stricture होगा. Okay, so fibrosis हो जाएगा. Okay, and then it would lead to stricture and shortening of the esophagus. And lastly, it can also lead to sliding hiatus hernia. We'll discuss further. Then Barrett's esophagus we have already discussed. So Barrett's esophagus में क्या होता है? There is intestinal metaplasia. Intestinal या क्या कौन सा? Columnar metaplasia. Please remember. और ये characteristic है because the presence of goblet cells is there. Intestinal metaplasia ही क्यों बोला जाता है इसको? Because there is presence of goblet cells which are characteristically found in the intestine. Okay, they are found only in the small intestine. Please remember. So goblet cells हमें दिखाई देते हैं. So remember, the better option is always not only columnar or intestinal metaplasia. It is intestinal metaplasia with goblet cells. Please remember, it is the pathognomic feature. So pathognomic feature of Barrett's अगर पूछा गया, it is presence of goblet cells. Okay, the investigation of choice पूछा गया, it is just endoscopy plus biopsy. You need to look for metaplasia, right? So the best investigation of choice would be endoscopy and biopsy. Treatment would be GERD से develop हुआ है, so the treatment of choice mostly remains PPI, that is your proton pump inhibitors like omeprazole, ओके, लैंसोप्रेजोल वगैरह. बट अगर सर्जिकल ट्रीटमेंट ऑफ चॉइस पूछा गया देन यू परफॉर्म अ सर्जिकल रिसेक्शन. जो पार्ट मेटाप्लेजिया जहां हुआ है यू रिसेक्ट दैट पार्ट एंड यू परफॉर्म अ गैस्ट्रिक पुलअप ऑपरेशन. ठीक है, सो स्टमक को ऊपर पुलअप कर दोगे एंड प्लाइकेट कर दोगे. सो सर्जिकल रिसेक्शन अलॉन्ग विद गैस्ट्रिक पुलअप ऑपरेशन. देन स्लाइडिंग हियाटस हर्निया. सो याद रखना हियाटस डायफ्राम में जो हियाटस होता है ये ओपनिंग होता है यहाँ से. अगर ये abnormally large है it can lead to protrusion of the abdominal contents into the thoracic cavity. Okay, and that can lead to the hernia, sliding hernia. Sliding मतलब आता जाता रहता है. Okay, please remember this. Then sliding hiatus hernia, okay, is the most common type of hernia. Remember please. Okay, so अगर most common type of internal hernia अगर पूछा जाता है then it is your sliding hiatus hernia. ठीक है, gastroesophageal junction जो होगा there are two types of sliding hiatus hernia. ठीक है, फर्स्ट एक तो जिसमें गैस्ट्रोइसोफेजियल जंक्शन जो होगा तुम्हारा इट इज इन द थोरैसिक कैविटी. ओके, एंड सेकेंड वेयर द गैस्ट्रोइसोफेजियल जंक्शन इज इन द अब्डोमिनल कैविटी इटसेल्फ. सो जो हियाटस हर्निया जिसमें गैस्ट्रोइसोफेजियल जंक्शन थोरैक्स में है, ओके, इट इज मोर कॉमन, इट इज नोन एज स्लाइडिंग टाइप. वेयर सेकेंड वाला जिसमें गैस्ट्रोइसोफेजियल जंक्शन अब्डोमेन में ही है एंड इसमें बस स्टमक लार्ज इंटेस्टाइन वगैरह प्रोट्रूड कर रहे हैं इनटू द थोरैसिक कैविटी, इट इज नोन एज पैरा ईसोफेजियल हर्निया और रोलिंग हर्निया और जायंट हर्निया. ठीक है, प्लीज रिमेंबर स्लाइडिंग इज अ स्मॉलर हर्निया. ठीक है, यहाँ बस स्टमक प्रोट्रूड करेगा इनटू द थोरैसिक कैविटी. बट पैराइसोफेजियल या रोलिंग या जायंट हर्निया में द अदर abdominal contents would also protrude into the thoracic cavity. Please remember. Okay, the differentiating feature gastroesophageal junction. Sliding में gastroesophageal junction ऊपर चला आता है thorax में. रोलिंग में क्या होता है बस contents ऊपर चले जाते हैं, junction वही के वही रहता है abdomen में. Please remember this. Okay, then moving further, reflux is associated with both of them. सिम्टम्स क्या होंगे? सिम्टम्स वुड मोस्टली बी चेस्ट पेन होगा, पोस्ट प्रांडियल फुलनेस होगा. ओके, आफ्टर ईटिंग देयर इज फुलनेस, देयर इज चेस्ट पेन. ओके, एंड ब्रीदिंग डिस्कम्फर्ट इज देयर. सो द सिम्टम्स ऑफ हियाटस हर्निया आर मोस्टली चेस्ट पेन, पोस्ट प्रांडियल फुलनेस एंड ब्रीदिंग डिस्कम्फर्ट. फर्स्ट इन्वेस्टिगेशन क्या है? फर्स्ट इन्वेस्टिगेशन परफॉर्म्ड इज योर चेस्ट एक्सरे. फर्स्ट इन्वेस्टिगेशन मैं बोला फिर से हैंडी होना चाहिए कोई इन्वेस्टिगेशन, दैट इज योर चेस्ट एक्सरे. इन्वेस्टिगेशन ऑफ चॉइस क्या है? Investigation of choice is your barium swallow. Okay, so barium swallow is your investigation of choice in cases of sliding hiatus hernia. And the treatment of choice is again Nissen's 360 degree fundoplication. ठीक है, so Nissen's fundoplication कर दो, stomach को tie कर दो around your esophagus. Okay, so this is Nissen's 360 degree fundoplication. Then moving further, CDH, that is your, ये already पढ़ चुके हैं पीड्स में. CDH is your congenital diaphragmatic hernia. ठीक है, so congenital diaphragmatic hernia is due to failure of the closure of pleuroperitoneal canal. So याद रख लेना pleural cavity है ये और ये peritoneal cavity है. So ये दोनों connected होती है prior. Okay, but if these are not closed properly, okay, there is an abnormal connection in between both of them, that can lead to a congenital diaphragmatic hernia. So failure of closure of pleuroperitoneal canal can lead to congenital diaphragmatic hernia. Most common कहाँ होता है? It is most commonly at the left side. Okay, most commonly at the left side. And अगर left side पे होगा posterolaterally, then that is known as your Bosch-Dalex hernia. Okay, most commonly on the left side posterolaterally it is known as Bosch-Dalex hernia. And दूसरा type कौन सा होता है? Morgagni's hernia. Morgagni's hernia कहाँ होगा? Anterolaterally होगा. Okay, so it is anterolaterally on the right side. So remember, अगर anterolaterally right side पे है it is Morgagni, posterolaterally left side पे है it is Bosch-Dalex, and Bosch-Dalex is more common type of CDH. Okay, so remember, what is contraindicated in cases of CDH? You all know. Until that I'll discuss the triad. So triad of CDH is क्या? First is your respiratory distress. Obviously intestinal contents अगर thorax में आ रहे हैं तो there would be respiratory distress. Second is the scaphoid abdomen, scaphoid और scooped out abdomen. So इस child में इस तरह की कुछ abdomen होगी, scooped out abdomen. Then next is your increased anteroposterior diameter of the chest. Okay, so intestinal contents अगर thoracic cavity में there is increased anteroposterior diameter of the chest. So the triad of CDH, first is respiratory distress, second is kyphoid or scooped out abdomen, and third is increased anteroposterior diameter of the chest. Treatment क्या होगा? You will just perform a surgery and close the hiatus. Contraindicated, yes, it is your bag and mask ventilation. So please remember, bag and mask ventilation is absolutely contraindicated in cases of congenital diaphragmatic hernia. Then moving further to esophageal cancer. Esophageal cancer already discussed. Most common type is your squamous cell carcinoma, and most common in Western countries. Anybody? Most common in Western countries is which type? Most common in Western countries is your yes, it is your adenocarcinoma. And adenocarcinoma की most common site कौन सी थी? Adenocarcinoma की most common site was your lower 1/3. Please remember. Okay, yes. Then it is associated, adenocarcinoma would be associated with the history of GERD, that is gastroesophageal reflux disease, or with Barrett's esophagus. And adenocarcinoma में क्या करोगे? बस तुम only surgical treatment. Okay, only surgical treatment is given. Then in cases of squamous cell carcinoma, most common site was your middle 1/3. Okay, इसमें risk factors क्या होंगे? So remember please, adenocarcinoma is associated with GERD या Barrett's esophagus. ठीक है, so अगर history दी होगी adenocarcinoma में GERD या Barrett's की दी होगी, और squamous cell carcinoma में history किसकी दी होगी? Of your H. pylori infection. ठीक है, so these are all the risk factors for squamous cell carcinoma. H. pylori infection, Plummer-Vinson syndrome. Anybody Plummer-Vinson syndrome के tried? I'll move further then. Mineral deficiencies. Okay, mineral deficiencies can also lead to squamous cell carcinoma or Tylosis palmaris, that is esophageal webs वगैरह. Okay, so please remember. Anybody? The triad of Plummer-Vinson syndrome. Yes, it is your iron deficiency anemia. So iron deficiency anemia में क्या दिखता है तुम्हें? Spoon shaped nails, that is your koilonychia. Plus is your angular stomatitis, and last is your glossitis. Please remember. ठीक है, so it is your iron deficiency anemia, angular stomatitis or glossitis along with chelosis sometimes. Okay, so please remember, this is the triad of Plummer-Vinson syndrome. Okay, पैथो में पूछा जा सकता है, मेडिसिन में भी. देन पैथोलॉजिकल सबटाइप्स होंगे इसोफेजियल कैंसर के. द मोस्ट कॉमन सबटाइप इज पॉलीपॉइडल, मतलब पॉलिप लाइक मास होगा. ओके, ऐसा पॉलिप लाइक मास वुड बी प्रोट्रूडिंग. सो मोस्ट कॉमन टाइप ऑफ इसोफेजियल कैंसर इज योर polypoidal. Okay, so it remember, most common type of esophageal cancer is polypoidal and it has the best prognosis. And next type is your fungating, मतलब इस तरह का कुछ. Okay, this is known as your fungating mass and it has the worst prognosis. So best prognosis is for polypoidal mass and worst prognosis is for a fungating mass. Please remember. Spread कैसा हो सकता है esophageal cancer का? Esophageal cancer can spread via local spread, मतलब local metastasis हो सकता है, lymphatic spread हो सकता है और hematogenous spread भी हो सकता है. First investigation performed in cases of esophageal cancer is your barium swallow. And barium swallow पे कौन सा appearance we have discussed earlier? Barium swallow पे, then barium swallow पे in esophageal cancer, which type of appearance we can see? So it is your rat tail appearance. Okay, it is your rat tail appearance. Please remember. Okay, no. Corkscrew was seen in diffuse esophageal spasm. Please, corkscrew was seen in diffuse esophageal spasm, whereas in esophageal cancer you can see rat tail appearance. Rat tail appearance. Bird beak is seen in Achalasia cardia. Please remember. Investigation of choice क्या होगा? Investigation of choice would be a cancer है तो obviously biopsy is the investigation of choice. So upper GI endoscopy plus biopsy. Staging investigation of choice. अगर तुम्हें staging करनी है esophageal cancer carcinoma की TNM staging, then the staging अगर पूछा गया staging investigation of choice, then it is your CECT, that is your contrast enhanced CT scan. So remember, अगर staging के लिए पूछा गया it is CECT. बस investigation of choice पूछा गया it is upper GI endoscopy plus biopsy. Please remember. And अगर डेप्थ असेस करने के लिए पूछा गया कि how much deep it has invaded. So depth assess करने के लिए investigation of choice would be your endoscopic ultrasound. ठीक है, endoscopic ultrasound करोगे. For depth endoscopic ultrasound. Staging CECT. Investigation of choice endoscopy plus biopsy. First investigation barium swallow. Please remember. And distant metastasis के लिए anybody, distant metastasis के लिए the investigation of choice anybody. For distant mets, the investigation of choice that we perform is, yes, it is your PET scan. It is your PET scan. Please remember. Okay, it is your positron emission tomography, and the dye used in PET is anybody. The dye used in PET is no. For distant mets, it is PET scan. PET scan for distant metastasis. For any type of cancer, it is PET scan for distant mets. The dye used in PETs is 18-fluorodeoxyglucose. Please remember, the dye used in PET scan is your 18-fluorodeoxyglucose. Please remember this. Okay, so distant metastasis के लिए we use PET scan and the dye used is 18-fluorodeoxyglucose. Treatment of choice क्या होगी esophageal cancer की? Obviously surgery, chemotherapy and radiotherapy. So remember, radiotherapy is for upper esophageal cancer. So अगर upper esophageal cancer होगा then you perform only radiotherapy. अगर lower esophageal cancer होगा you perform a surgery directly. Please remember. Then moving further, most common cause of hematemesis. Okay, hematemesis is blood and vomiting. So most common cause of hematemesis is your peptic ulcer. Okay, peptic mainly कौन से type का? Duodenal ulcer. Okay, yes, most common cause of hematemesis is your peptic or duodenal ulcer, followed by esophageal varices. Anybody, esophageal varices is associated with which condition? Esophageal varices is associated with, I'll move further in meanwhile. Then most common cause of bleeding per rectum. Okay, bleeding per rectum ki most common cause is your hemorrhoids. If asked, the most common, it is yes, it can be associated with liver cirrhosis, but the better answer would be your portal hypertension. Yes, portal hypertension is associated with liver cirrhosis, but the better answer is always portal hypertension. Okay, if both are an option, mark portal hypertension. Most common cause of bleeding per rectum is your hemorrhoids in cases of adults. In cases of children, it is your juvenile polyp. Juvenile मतलब adolescent age group जो तुम्हारा 6 to 18 वाला. Okay, so adolescent and children का age group, that is known as juvenile. Okay, so juvenile polyps would be the most common cause of bleeding per rectum in children, and in elderly it is your colorectal carcinoma. So remember, अगर bleeding per rectum की most common cause पूछी गई, in adults it is hemorrhoids, children it is juvenile polyps, and elderly it is colorectal cancer. Hematemesis की अगर most common cause पूछी गई, it is peptic or duodenal ulcer, followed by esophageal varices. Margin of resection, yes, for esophageal cancer, please remember, for esophageal cancer, the margin of resection, जब तुम surgery perform करोगे, proximally it should be 10 centimeters and distally it should be 5 centimeters. This is the margin of resection. Please remember, total 15 centimeter होना चाहिए, proximally 10, distally 5 centimeter. Please remember. Then moving to gastritis. ठीक है, so gastritis अलग अलग टाइप का हो सकता है, acute gastritis or chronic gastritis. Okay, and there are different types of gastritis also. So first talking about acute gastritis, most common cause of acute gastritis is your NSAIDs, non-steroidal anti-inflammatory drugs like aspirin, ibuprofen वगैरह. So acute gastritis के most common cause is your NSAID intake or drug intake, followed by alcohol. So most common cause of acute gastritis is NSAIDs, followed by alcohol. Please remember. Most common clinical feature of acute gastritis would be hematemesis. So most common clinical feature for acute gastritis is your hematemesis. Treatment क्या करोगे तुम? First of all, acute gastritis है, acutely patient present कर रहा है, mostly to the emergency. Okay, bleeding चल रही है, continuously hematemesis चल रहा है. So the first step that you perform, option में होगा, so the first step you will perform is basic resuscitation. So always remember, कोई भी acute condition अगर होगी and patient presents to you where he or she is bleeding or he or she is hemodynamically unstable, the first step to be performed is basic resuscitation. ठीक है, IV fluids वगैरह start कर दोगे तुम. So if IV fluids वगैरह are an option, the first step would be that. Okay, So remember, first is basic resuscitation, that is your IV fluids would be started. Indication of blood transfusion कब होगा? Okay, upper GI endoscopy करो. Indication of blood transfusion कब होगा? Upper GI endoscopy करोगे, and if still it is bleeding, okay, if still it is bleeding after performing all this, then it is an indication of blood transfusion. तो क्या करोगे? सबसे पहले तो तुम upper GI endoscopy करोगे, and you will perform a endoscopic sclerotherapy. You will perform a endoscopic sclerotherapy. And sclerosing agent, I have told you earlier, the most common sclerosing agent used is, I have told you in arterial disorders, the most common sclerosing agent जो use करते हैं हम आर्टरी या वेन स्क्लेरोज करने के लिए, anybody, it is known as polydocanol. Please remember, the most common sclerosing agent used is polydocanol. So you will perform a endoscopic sclerotherapy, जो भी bleeding vessel है, then you will perform a, then you can give adrenaline, okay, you can give adrenaline, then you can perform a diathermy, bipolar cautery वगैरह diathermy perform करोगे, then you will perform a angiography, okay, इससे भी अगर bleeding stop नहीं हो रही, then you will perform a angiography. Angiography करके you will perform angioembolization. और angioembolization कैसे करते हो? With the help of coils, foams वगैरह. Okay, so most commonly we use coils for the process of angioembolization. और finally अगर इससे भी stop नहीं होगी, we will perform a laparotomy or a gastrotomy and will then ligate the bleeding vessel. Please remember. So सबसे पहले endoscopy, endoscopic sclerotherapy, adrenaline, diathermy, angiographic embolization, and finally laparotomy or gastrotomic ligation. Please remember this. Then next type of gastritis is your Menetrier's gastritis. So Menetrier's gastritis में क्या होता है? So जो रूगे होते हैं ना, gastric रूगे, you know, these are your gastric रूगे for absorption. So these gastric रूगे become huge and large, okay? So in Menetrier's gastritis there are huge and large gastric रूगे. इसका image आ सकता है. I'll show you that endoscopic picture afterwards. So Menetrier's gastritis, remember, it is a pre-malignant condition. It can develop into cancer. So it is a pre-malignant condition, and it is seen and इसमें क्या होगा? There would be hypoproteinemia. So absorption would be impaired. Okay, so there would be hypoproteinemia. Please remember this. And hypoproteinemia would lead to edema. So there can be associated edema also in cases of Menetrier's gastritis. So please remember. Then next is your erosive gastritis. Erosive gastritis is mainly due to NSAIDs. ठीक है, NSAIDs से होगा. Then next is your AIDS. AIDS में gastritis होता है. It is due to Cryptosporidium parvum. So please remember, the gastritis which is seen in AIDS is mainly due to which organism? It is due to Cryptosporidium parvum, that is Cryptosporidiasis. Then the next is your eosinophilic gastritis. Eosinophilic gastritis is allergen mediated. So when there is allergen exposure, it can lead to gastritis, which is known as eosinophilic gastritis. So there would be eosinophilia associated with it. And lastly is your reflux or alkaline gastritis. Okay, reflux or alkaline gastritis कब होगा? When the alkaline contents of the duodenum, they regurgitate or they are refluxed into the stomach. Okay, so that can lead to reflux or alkaline gastritis. Then chronic gastritis के तीन type होते हैं mainly, type A, type B and type C. Okay, so type A is for autoimmune. Okay, so type A is for autoimmune. B is for bacteria, that is your H. pylori. And C is for your chemicals, that is toxins like alcohol वगैरह. Okay, please remember. So type A chronic gastritis, it is due to which pathology? Autoimmune pathology. ठीक है. And autoimmune में there are antibodies formed, and these antibodies are formed against what? Yes, these antibodies are formed against your parietal cells. Antibodies are formed against parietal cells, and therefore parietal cells secrete what? HCl and intrinsic factor of Castle. So there would be decreased levels of HCl and intrinsic factor of Castle. So decreased levels of HCl is known as hypo or achlorhydria. So you will see hypo or achlorhydria. And secondly, intrinsic factor of Castle will cause deficiency of which vitamin? Decreased intrinsic factor of Castle will lead to deficiency of which vitamin? Anybody? It would lead to deficiency of vitamin B12. Yes, it would lead to deficiency of vitamin B12, leading to pernicious anemia. So remember, मैंने बोला है already, अगर autoimmune cause की वजह से deficiency of vitamin B12 होती है, it would lead to pernicious anemia. Okay, remember. Then increased gastrin would also be there. Okay, so as HCl is secreted less, I have already explained this to you in physiology. जब HCl production के लिए कौन stimulate करता है? Gastrin stimulate करता है. As HCl is less in this condition, gastrin would be secreted in excess. Okay, so there would be increased gastrin levels. Then there would be enterochromaffin cell like adenoma. So ECL cells जो होते हैं, okay, they would undergo hyperplasia and finally adenoma, and lastly pernicious anemia as explained. Then most common site of gastric cancer in pernicious anemia is what? Is your fundus. Okay, so most common site of gastric cancer in cases of pernicious anemia is your fundus. So this is your fundus of the stomach. So this is the most common site of gastric cancer in cases of pernicious anemia. Okay, yes. Then type B is, I already explained you, it is due to bacteria, that is your H. pylori, Helicobacter pylori. Helicobacter pylori कौन सी enzyme होती है Helicobacter pylori में? Anybody? There are these toxins for sure. These are the toxins which are seen in Helicobacter pylori, that is CAG-A, VAC-A and proteases, which are responsible for the pathology. But the main enzyme on the basis of which we diagnose Helicobacter pylori infection is, anybody? It is, yes, it is your urease enzyme. Yes, it is your urease enzyme. Okay, so ये urease enzyme क्या करता है? It breaks down urea. Okay, so it breaks down urea into carbon dioxide and ammonia. So remember please. Okay, so ammoniacal smell आएगी breath से. Okay, please remember. So therefore we perform a urea breath test. We perform a urea breath test or a rapid urease test. Okay, but the diagnostic method of choice, yeah, investigation of choice for type B gastritis is always upper GI endoscopy plus biopsy. Okay, so the best investigation अगर पूछा जाए it is upper GI endoscopy plus biopsy. उसके अलावा अगर पूछा जाए then you can mark, अगर ऑप्शन में नहीं है biopsy then you can mark rapid urease test or urea breath test. Okay, so please remember this. The stain used for, ये माइक्रो में पढ़ा होगा, पैथो में पढ़ा होगा. The stain used for H. pylori is a very characteristic stain. Okay, so the stain used for H. pylori is Warden starry stain. Okay, the stain used for H. pylori is Warden starry stain. We also use a normal Giemsa stain, but the most characteristic अगर पूछा जाए it is Warden starry stain. Please remember. Then moving on to your peptic ulcer, important topic from aspect of surgery and medicine. Very easy, बस important चीजें याद रख लो इसमें. Okay, so the most common site of peptic ulcer is your first part of duodenum. So दो टाइप के अल्सर्स होंगे पेप्टिक अल्सर में, either duodenal ulcer और gastric ulcer. ठीक है, और more common कौन से दोनों में से? Duodenal ulcers. So remember the most common site of peptic ulcer is your D1, that is your first part of duodenum, followed by your incisura angularis. So this is your stomach. Just a minute. So this is your stomach. Okay, and this is what is incisura angularis. जहाँ पे ये curve दिख रहा है, that is your incisura angularis on the lesser curvature. Okay, so remember the most common site for peptic ulcer, it is your first part of duodenum followed by incisura angularis. Then risk factors क्या क्या होंगे? Definitely as we have studied now, that is your H. pylori infections can be there. Stress. So stress में ulcers हो सकते हैं. Stress can be in two conditions. First is head injury and second is burns. So if in head injury the ulcers are there, they are known as, anybody? And in burns they are known as, दोनों टाइप कर लो. And lastly the last risk factor is your Zollinger-Ellison syndrome. Zollinger-Ellison syndrome में क्या होता है? There are gastrinomas. Okay, there are tumor of the gastrin secreting cells. Okay, G cells जो होते हैं उनके ट्यूमर बन जाते हैं. So there are gastrinomas in Zollinger-Ellison syndrome. And ये कौन से ट्रायंगल में होता है ये भी बता दो. Yes, so remember if they are due to head injury, then those are known as Cushing ulcers. Okay, if those are due to head injury, those are known as Cushing ulcers. और अगर burns की वजह से है, then those are known as curling ulcers. अगर burns की वजह से है, then those are known as curling ulcers. Gastrinoma की most common site बता दो जल्दी से. Most common site for gastrinoma is, most common site for gastrinoma is your sorry, it is your Passaro's triangle. Please remember. Okay, it is your Passaro's triangle. So the most common site for your gastrinomas are your Passaro's triangle or gastrinoma triangle, they are known as. Okay, so we have discussed discussed it earlier also. We'll discuss in medicine further about this. Okay, so abhi yaad rakh lo bas, Passaro's triangle or gastrinoma triangle are the most common site for gastrinoma, which are seen in Zollinger-Ellison syndrome. Then टॉकिंग अबाउट योर ड्यूडेनल अल्सर, सो यहाँ पे डिफरेंशिएटिंग फीचर्स है कुछ, दोनों याद रख लेना, एक साथ पढ़ लो, ड्यूडेनल अल्सर एंड गैस्ट्रिक अल्सर्स. ओके, सो विच आर मोर कॉमन अमॉन्ग बोथ ऑफ देम? Remember, duodenal ulcers are more common. Okay, so remember which are more common? Duodenal ulcers are more common. Then second factor to be remembered in duodenal ulcer, it is common in which age group? It is common in young age group. So याद रख लेना, duodenal ulcers किस age group में common होंगे? Young age group में common होंगे. Whereas gastric ulcers are common in elderly. So yeah, remember gastric pathologies are common in elderly age group. Then duodenal ulcers ये अमीरों के अल्सर है, ठीक है. सो दीज आर मोस्टली सीन इन रिच पॉपुलेशन, वेयरएज गैस्ट्रिक अल्सर्स आर सीन इन पुअरर पॉपुलेशन. ड्यूडेनल अल्सर्स आर स्मॉलर, वेयरएज गैस्ट्रिक अल्सर्स आर लार्जर. देन ड्यूडेनल अल्सर्स में अगली बात, देयर इज इंक्रीज्ड HCl, वेयरएज इन गैस्ट्रिक अल्सर either there is normal or decreased levels of HCl. So this is an important feature. Duodenal ulcers में there is increased HCl, whereas in gastric ulcer there is normal or decreased HCl. Please remember. Then next, this is very important feature जिसकी वजह से तुम diagnose कर पाओगे, differentiate कर पाओगे. Duodenal ulcer में there is hunger pain. What is hunger pain? खाने के 2 घंटे बाद. Okay, after meals, after 2 hours pain starts in cases of duodenal ulcers. Whereas in gastric ulcer, pain is known as meal pain. Meal pain का मतलब the pain starts within 30 minutes. Okay, the pain starts within 30 minutes of meals. So अगर खाना खाने के 2 घंटे बाद पेन है, then that is suggestive of duodenal ulcer. अगर खाना खाने के आधे घंटे में पेन हो रहा है, then that is seen in that is suggestive of gastric ulcers. Please remember. So इस वजह से क्या होता है, यहाँ पे पेट खाली रहने से पेन होता है, so patient खाता रहता है. So in cases of duodenal ulcer, the patient would be obese. There would be increase in weight. The patient would be obese. Okay. Whereas in cases of gastric ulcer, the meal leads to pain. Okay, खाने के वजह से पेन हो रहा है, therefore the patient avoids meals and therefore the weight decreases. There would be a thin, slim patient. Okay, please remember. So एक केस ऐसा ही आएगा. For example, अगर ऐसा केस आता है, a 20-year-old male presents to you with epigastric pain. Okay, and pain which starts after 2 hours of meals. Okay, and obese वगैरह है. So all these are suggestive of duodenal ulcer. But if a case comes to you like a 60-year-old male presenting to you from a poorer background, okay, with pain which starts approximately 15 to 20 minutes or 30 minutes after meals, then that is very much suggestive of gastric ulcer. So blood group associated, ये शायद ही पूछ लेंगे, but please remember duodenal में O आता है, therefore the blood group associated is O. Gastric में A है, therefore the blood group associated is A. So this is somewhat this can help you remember this thing. Okay, not very much important, but please remember. Then diagnosis के लिए you will perform a upper GI endoscopy. Ulcer है, the diagnostic method of choice या investigation of choice would be your upper GI endoscopy. ट्रीटमेंट के लिए क्या परफॉर्म करोगे तुम? ट्रीटमेंट के लिए you will give anybody sorry, you will perform lifestyle modifications. So first line क्या होगा? Lifestyle modifications, quit alcohol, quit smoking, ये वो. And you can also give the treatment. Drug of choice अगर पूछा गया, it is your PPIs again, proton pump inhibitors. So PPIs कहाँ थे? पेप्टिक अल्सर में ड्रग ऑफ चॉइस से, GERD में ड्रग ऑफ चॉइस से, ठीक है. सो प्लीज रिमेंबर दिस. देन सर्जिकल ट्रीटमेंट ऑफ चॉइस अगर पूछी गई गैस्ट्रिक अल्सर्स के लिए, ओके, सो सर्जरी अगर पूछी जाती है इन केसेस ऑफ गैस्ट्रिक अल्सर, विल परफॉर्म पार्शियल गैस्ट्रेक्टमी. सो जो भी अल्सर वाला पार्ट है दैट विल रिमूव, will perform a partial gastrectomy. And partial gastrectomies, 2 टाइप की सर्जरीज हो सकती है, Billroth 1 and Billroth 2. So please tell me Billroth 1 में क्या करेंगे हम, and Billroth 2 में क्या करेंगे हम. Okay, then in meanwhile I'll talk about duodenal ulcers. So duodenal ulcers में we'll perform a highly selective vagotomy. Highly selective vagotomy perform करेंगे. As we all know, vagus has a inhibitory action. Okay, vagus has an inhibitory action on gastric GIT. Okay, so remember vagus has an inhibitory action on GIT. So you will perform a वेगोटोमी, जिसकी वजह से क्या होगा, HCl सिक्रीशन कम हो जाएंगे, और HCl सिक्रीशन अगर कम हो जाएंगे तो it will prevent from further developing the ulcer further. Okay, so remember you will perform a highly selective vagotomy, or you can perform a truncal vagotomy. Okay, जो वेगस की ट्रंक है वही काट दो तुम. Okay, so truncal vagotomy can be performed along with a drainage operation. So please remember, recurrence के chances कौन सी सर्जरी में ज्यादा है, highly selective vagotomy में या truncal vagotomy में? Recurrence chances are most commonly seen with, yes, it is seen with highly selective vagotomy. So highest recurrence is seen with highly selective vagotomy. Please remember. Okay, so Billroth 1, Billroth 2 के बारे में anybody? So Billroth 1 में जब तुमने partial gastrectomy कर दी, okay, stomach आधा काट दिया for example, उसके बाद you will stitch it along with the jejunum, okay, sorry, duodenum, that is your Billroth 1. And Billroth 2 में क्या करोगे, you will bring jejunum up and you will stitch it along with your jejunum. ठीक है, so याद रख लो पहले, Billroth 1 is partial gastrectomy with gastroduodenostomy, whereas Billroth 2 is partial gastrectomy with gastrojejunostomy. Please remember, gastroduodenostomy Billroth 1, gastrojejunostomy Billroth 2. Please remember this. Okay, then moving further, surgical treatment of choice for recurrence. अगर बार बार अल्सर हो रहा है, okay, then the surgical treatment of choice that you will perform is your truncal vagotomy plus antrectomy. Okay, तुम antrum भी हटा दोगे. So truncal vagotomy plus antrectomy is the surgical treatment of choice for cases of recurrence. Please remember. Complications क्या होंगे if you perform vagotomy? Okay, अगर तुम वेगस निकाल देते हो, so motility would be inhibited somewhere. Okay, so motility impair हो जाएगी, and जैसे ही motility impair हो जाएगी, gall bladder की भी motility impair होगी. So gall bladder is not able to empty the bile from it. Okay, so bile accumulate होती रहेगी, and इसकी वजह से क्या form हो जाएंगे अंदर, gall stones. So remember, vagotomy can lead to formation of gall stones, and the nerve responsible for this is known as criminal nerve of Grassi. Please remember, the nerve responsible is known as criminal nerve of Grassi. कौन सी ब्रांच है वेगस की, criminal nerve of Grassi. Sorry. Now the next complication can be bleeding, obviously. Okay, so in cases of duodenal ulcer, कौन सी artery bleed करती है? The question has been asked on this previously. Okay, so in cases of duodenal ulcers, which artery bleeds more commonly? It is your gastroduodenal artery. In cases of gastric ulcer, the most common artery which bleeds is left gastric artery. So bleeding में duodenal ulcer में most commonly which artery bleeds? It is your gastroduodenal artery. Whereas in gastric ulcer, the most common artery which bleeds is left gastric artery. Please remember. Then moving on to further perforation. Perforation हो सकता है mostly in cases of duodenal ulcer, the perforation is anterior. Please remember, in cases of duodenal ulcer, the perforation is mainly anterior. Please remember. Okay, in the first part of the duodenum. अगर perforation हो जाता है, you will perform exploratory laparotomy. You will perform an exploratory laparotomy with Graham's patch. Graham's patch is of omentum. So please remember, what is Graham's patch? It is a omental patch. So omentum उठाओगे और चिपका दोगे जहाँ पे perforation हुआ है. So you will perform an exploratory laparotomy with Graham's omental patch. Please remember. The other complications can be your nutritional deficiencies. तुमने stomach निकाल दिया, obviously absorption would be impaired, so nutritional deficiencies would be seen. Duodenal stump blowout would be seen. Okay, so जो duodenal stump है ना, so this is for example your stomach, and ये तुमने duodenum उसके साथ join कर लिया. So ये जो duodenal stump बचा, that can rupture. Okay, so that is known as your duodenal stump blowout, which is more commonly seen on 4th post-operative day. Okay, 4th to 5th post-operative day पे दिखेगा 4 से 5 दिन बाद. Then coming to dumping syndrome, जिस पे questions थे पहले भी. So dumping syndrome is of two types: early dumping syndrome and late dumping syndrome. Please remember. Okay, so early dumping and late dumping syndrome. दो तीन चीजें याद रख लो बस. अर्ली डंपिंग सिंड्रोम किस वजह से होता है? इट इज ड्यू टू रैपिड एम्प्टिंग. ओके, सो अब जो स्टमक में आ रहा है वो इमीडिएटली कहाँ जा रहा है? इंटेस्टाइन में जा रहा है. ओके, सो रैपिड एम्प्टिंग हो रही है, और रैपिड एम्प्टिंग की वजह से क्या हो रहा है? इंटेस्टाइन पे बहुत सारा एक साथ प्रेशर आ रहा है. ओके, ऑल द फूड इज गोइंग डायरेक्टली इनटू द इंटेस्टाइन एंड देयरफॉर इंटेस्टाइन नीड्स टू वर्क मोर, एंड इसलिए पूरा ब्लड फ्लो कहाँ डायरेक्ट हो जाता है? इंटेस्टाइन में डायरेक्ट हो जाता है. ओके, the blood flow is directed towards the intestine, which leads to this hypovolemic symptoms. Okay, so hypovolemic symptoms होंगे. Okay, there would be dizziness वगैरह in the patient. Okay, the patient can fall. Okay, collapse वगैरह हो सकता है patient. So there would be hypovolemic symptoms in cases of early dumping syndrome. It is due to rapid emptying of the food into the intestine. Okay, which leads to reflex vasodilation in the intestine. Please remember. Then second is your late dumping syndrome. Late dumping syndrome किस वजह से होगा? Due to rapid absorption of carbohydrates. Rapidly carbohydrates absorb हो जाएंगे, जिसकी वजह से क्या हो जाएगा? Hypoglycemia हो जाएगा. Okay, there is hypoglycemia because if rapid absorption of carbohydrates lead to excess secretion of insulin. Okay, एकदम rapidly carbs absorb हो गए, एकदम बहुत ज़्यादा स्टिमुलस मिल गया इंसुलिन को, सो देयर इज एक्सेस ऑफ इंसुलिन विच इज सिक्रेटेड एंड दिस एक्सेस ऑफ इंसुलिन विल लीड टू हाइपोग्लाइसीमिया. प्लीज रिमेंबर. सो रिमेंबर, अर्ली डंपिंग में क्या हो रहा था? हाइपोवोलेमिक सिम्टम्स हो रहे थे, और लेट ग्लाइसीमिया में क्या होंगे? हाइपोग्लाइसेमिक सिम्टम्स होंगे. प्लीज रिमेंबर दीज टू थिंग्स वुड गेट ईजियर. Then next one is your bezos. What are bezos? Bezos are nothing but accumulation of something. Okay, so bezos are trichobezos. ट्राइको मतलब हेयर. ठीक है, ट्राइकोलॉजी हमने पढ़ी है ना फॉरेंसिक में. सो ट्राइको इज नथिंग बट हेयर. सो ट्राइकोबेजोस आर सीन मेनली इन ट्राइकोटिलोमेनिया. व्हाट इज ट्राइकोटिलोमेनिया? इट इज योर साइकेट्रिक डिसऑर्डर. ओके, सो ट्राइकोटिलोमेनिया, इट इज योर साइकेट्रिक डिसऑर्डर सीन इन यंग फीमेल्स. ओके, सो ट्राइकोटिलोमेनिया इज सीन इन यंग फीमेल्स. ठीक है, सो ट्राइकोटिलोमेनिया में जो यहाँ पे औरत यंग लड़कियाँ अपनी बाल नोचती है और खुद ही खा जाती है. ओके, सो रिमेंबर दिस वुड बी ट्राइकोटिलोमेनिया इन विच वी कैन सी ट्राइकोबेजोर. दैट इज एक बाल मिलेंगे पूरे स्टमक में. ओके, सो दैट इज नथिंग बट ट्राइकोबेजोर. सेकेंड इज फाइटोबेजोर. फाइटोबेजोर इज वेजिटेबल मैटर. ओके, सो कच्चे कोई भी वेजिटेबल मैटर जो होगा दैट द पर्सन वुड इंजेस्ट एंड इट लीड टू accumulation of this vegetable matter in the stomach, that is known as phytobezor. And last one is your lactitobezor. Lactito नाम से पता चल रहा है, it is due to dairy products. Okay, milk and dairy products. Then coming to metabolic या bariatric surgeries. Metabolic या bariatric surgeries कब perform करोगे? When the patient is obese. So obese patients में you perform a bariatric or a metabolic surgeries. It is seen in cases of morbid obesity. और morbid obesity मतलब जो obesity जो बिल्कुल ही कंट्रोल नहीं हो पा रही है. मॉर्बिड ओबेसिटी इज व्हेन बीएमआई इज मोर देन 35. ओके, या फिर देयर आर कमॉर्बिड कंडीशंस. ओके, सो बीएमआई मोर देन 35 अलोंग विद कमॉर्बिड कंडीशंस, या फिर बीएमआई अलोन मोर देन 40 विदाउट एनी कमॉर्बिडिटी ऑल्सो. सो दिस वुड बी डायग्नोज्ड एज मॉर्बिड ओबेसिटी. सो मॉर्बिड ओबेसिटी कब बोलेंगे? बीएमआई मोर देन 35 अलोंग विद सम कमॉर्बिडिटीज, मतलब दूसरे डिसीजेस लाइक डायबिटीज वगैरह, मेटाबॉलिक एक्स सिंड्रोम वाले, एंड या फिर only BMI more than 40 would be diagnosed as morbid obesity. Please remember, there are different types of metabolic bariatric surgeries. The first is your bypass surgery. Okay, so bypass surgery में क्या करोगे? It is also known as ROX and Y surgery. Okay, bypass surgery is also known as ROX and Y surgery. Okay, when you take up the jejunum and tie it and stitch it along your stomach. Okay, so that is your ROX and Y bypass surgery. Okay, please remember. Then second is your restrictive surgery. So restrictive surgeries में क्या होता है? कम स्टमक की कैपेसिटी तुम कम कर देते हो, and there are different kinds of restrictive surgeries. First is LAGB. What is LAGB? That is laparoscopic sorry, that is your laparoscopic antral gastric banding. Okay, so तुम एक बैंड लगा देते हो स्टमक के आसपास. Okay, so that is your laparoscopic antral gastric banding. Okay, then second is your vertical banded gastroplasty. Okay, vertical banded gastroplasty, एक vertically तुम बैंड अप्लाई कर देते हो ऐसे. And last is your sleeve gastrectomy. In sleeve gastrectomy what you do? You cut out the stomach somewhat. Okay, बस एक पतला सा स्टमक, एक पाथवे रहने देते हो. This is what is your sleeve gastrectomy. ठीक है, so please remember this. So these are some kind of बेरियाट्रिक सर्जरीज नीट पीजी में क्वेश्चन आया इस पे, एफएमजी में बस एक ही बार क्वेश्चन था. देन गैस्ट्रिक कैंसर, द मोस्ट कॉमन साइट ऑफ गैस्ट्रिक कैंसर इज योर प्री पाइलोरिक रीजन. सो ये जो तुम्हारा पाइलोरस है, okay, so this is your pylorus. So this pre-pyloric region is the most common site of gastric cancer, followed by your cardia. So remember, pre-pyloric region is the most common site of gastric cancer, followed by cardia. Okay, please remember. Then talking about your Bohrmann's classification. So gastric cancer में कौन सा classification है? There is a Bohrmann's classification. There is a Bohrmann's classification. Type 1 है, that is polypoidal. Okay, टाइप 1 इज पॉलीपॉइडल, मतलब पॉलिप लाइक मास होगा. टाइप 2 इज सुपरफिशियल, मतलब सुपरफिशियली बस इरोडेड है या फिर मास है. टाइप 3 इज अल्सरो इनफिल्ट्रेटिव. तो टाइप 3 में एक अल्सर बन चुका है एंड देयर इज इनफिल्ट्रेशन, लोकल इनफिल्ट्रेशन ऑफ लिम्फोसाइट्स वगैरह. सो टाइप 3 इज अल्सरो इनफिल्ट्रेटिव. एंड टाइप 4 इज लाइनाइटिस प्लास्टिका. व्हाट इज लाइनाइटिस प्लास्टिका? लाइनाइटिस प्लास्टिका इज आल्सो नोन एज लेदर बॉटल स्टमक. सो यहाँ पे diffuse growth होती है. okay, there is a diffuse growth throughout the stomach in cases of Lionitis plastica, and which leads to a leather bottle stomach. okay, it leads to a leather bottle stomach, almost leather जैसा stomach walls बन जाती है Lionitis plastica में. please remember. so type 1 कैसी थी? polypoidal growth थी. type 2 कैसी थी? superficial growth थी. type 3 कैसी थी? ulcero infiltrative growth थी. and type 4 कैसी है? Lionitis plastica. And Lionitis plastica is also known as leather bottle stomach and has the worst prognosis obviously. Then Troisius sign दिखेगी हमें. What is Troisius sign? So Troisius sign is seen in cases of gastric cancer. Troisius sign also known as Virchow's node. So remember, Troisius sign या Virchow's node क्या होता है? It is metastasis to the left supraclavicular lymph node. So please remember, अगर gastric cancer is metastasized to left supraclavicular lymph node, it is known as Troisius sign, also known as Virchow's node. So Virchow's node कौन सी वाली nodes है? Left supraclavicular. Please remember. Okay, it is also known as Troisius sign. Seen in which cancer? It is seen in gastric cancer. And iris nodes. Iris nodes is metastasis to anybody? Iris nodes is metastasis to your axillary lymph nodes. Please remember, metastasis to your axillary lymph nodes is known as iris lymph nodes. Please remember. Then principal lymph nodes. Principal lymph nodes मतलब वो organ जिसमें drain करता है. okay, so principal lymph nodes are the ones which are first affected. okay, so in cases of stomach they are your celiac lymph node. Please remember. okay, so principal lymph node या sentinel lymph node होंगे. So those are the lymph nodes in which the organ directly drain into, and उधर metastasis के chances सबसे ज़्यादा high होंगे. okay, please remember this. And metastatic organs in cases of gastric cancer, it is your spleen, it is your pancreas, liver और lungs. तो आसपास के जो भी है local spread हो सकता है either into spleen या फिर pancreas या liver या ऊपर lungs में. ठीक है, please remember. Then metastasis can be to other organs या other structures as well in cases of gastric cancer, and this can be asked also. So remember, if the metastasis is in pouch of Douglas, it is known as, so the rectouterine pouch या pouch of Douglas में अगर metastasis है, then that is known as your Blummer's shelf. So remember, metastasis from gastric carcinoma to pouch of Douglas is known as your Blummer's shelf. अगर metastasis is to the ovaries, अगर metastasis from gastric cancer is to the ovaries, then that is known as your Krukenberg's tumor. Please remember, then that is known as your Krukenberg's tumor. और अगर metastasis umbilicus के around है in the periumbilical region, अगर periumbilical region में अगर metastasis है from the gastric cancer, then it is your Sister Mary Joseph nodules. So remember, pouch of Douglas, Blummer's shelf. Pouch of Douglas, Blummer's shelf. Periumbilical region, Sister Mary Joseph nodules. Periumbilical region में क्या बोलेंगे? Sister Mary Joseph nodules. And ovaries में अगर हो तो Krukenberg's tumors. Please remember. Okay. So on Krukenberg's tumors, mostly case would present like a ovarian cancer जैसे. Okay. But on histopathology, you will find some gastric cells also. So that is very much suggestive of a Krukenberg tumor. Please remember this. And one more classical feature, Krukenberg tumor में और कौन से type के cells होंगे on histopath? There would be signet ring cells. Please remember, there would be signet. Patho का question. Remember, Krukenberg tumor की histopath पे कैसे cells होंगे? Signet ring cells होंगे, कुछ इस तरह से. Okay. So this is what a signet ring looks like. Signet ring is also seen in one more lung pathology. Anybody? Signet ring appearance on HRCT. We can see signet ring appearance. Anybody? In which disease? Yes, it is bronchiectasis. It is bronchiectasis में शाबाश. So signet ring appearance is also seen on HRCT of bronchiectasis. Please remember, okay? Then and tree in bud appearance is also seen in bronchiectasis. Now for diagnosis of gastric cancer, you perform first of all a clinical examination, palpation वगैरह. Then you perform a ultrasound abdomen. First investigation अगर पूछा जाए तो क्या होगा? Ultrasound abdomen. So remember, first investigation in cases of abdominal pathologies is your ultrasound abdomen, followed by your endoscopic plus biopsy. So upper GI endoscopy plus biopsy. So अगर investigation of choice पूछा जाए तो biopsy. Investigation of choice is biopsy. First investigation is ultrasound abdomen. Please remember. अगर staging के लिए पूछा जाए, we already discussed this. Staging के लिए अगर पूछा जाता है, then it is your CECT abdomen. Depth के लिए अगर पूछा जाता है, it is same as esophageal cancers. It is your endoscopic ultrasound. So remember, first investigation, ultrasound abdomen. Investigation of choice, upper GI endoscopy plus biopsy. Staging investigation of choice, CECT abdomen. Depth investigation of choice, endoscopic ultrasound. And distant meds के लिए we have already discussed, it is your PET scan. Okay, please remember. ट्रीट में पेट स्कैन में डाई कौन सा यूज हो रहा था? 18 फ्लोरोडिऑक्सी ग्लूकोज. हाफ लाइफ कितनी 18 फ्लोरोडिऑक्सी ग्लूकोज की? 110 to 120 minutes. Please remember. Okay. Then the treatment in cases of gastric cancer, we perform endoscopic resection. अगर early gastric cancer है, we just perform an endoscopy, resect the part, okay, resect the tumor. But अगर advanced है, okay, advanced gastric cancer है, then we perform either a partial or a total gastrectomy. Okay, we perform either a partial or a total gastrectomy. Please remember this. Then gastric polyps. Okay, so gastric polyps में most common type are your hyperplastic polyps. Most common type of gastric polyps are hyperplastic polyps. Most common type of gastric polyps are hyperplastic polyps. The other types of polyps can be Hematomatous polyps. Hematomatous polyps is seen in one syndrome. Hematomatous polyps is seen in one syndrome along with hyperpigmented spots, around the lips, and hematomatous polyps, and that syndrome is known as Peutz-Jeghers syndrome. Please remember. Okay, so अगर hyperpigmented spots है around the lips, okay, melanosis बोलते हैं उसको, melanosis अगर है around the lips, और hematomatous polyps है अगर stomach में, then that is diagnostic of Peutz-Jeghers syndrome. Okay, images आ सकती है इस पे, I'll show you the image afterwards. Then retention polyps. Okay, retention polyps किस में बनेंगे? मतलब secretions retain हो रहे हैं and इसकी वजह से एक polyp like cyst like structure बन गया. Retention polyps are seen in which syndrome? They are seen in Cronkhite-Canada syndrome. Please remember, they are seen in Cronkhite-Canada syndrome. Gene mutation पूछा जा सकता है Cronkhite-Canada syndrome का from medicine. So remember, in Cronkhite-Canada syndrome, the gene mutation is P10 gene mutation. It is P10 gene mutation. Please remember. Okay. Then moving further, it is your adenomatous polyps. Last is your adenomatous polyps, and adenomatous polyps most commonly कहाँ होते हैं? In the antrum. Okay, and remember, adenomatous polyps can turn malignant. So अगर pre-malignant polyps पूछे गए, those are your adenomatous polyps. Which polyps has a malignant potential? Adenomatous polyps. Most common type of polyps, hyperplastic polyps. Peutz-Jeghers syndrome में hematomatous polyps. And chronic Candida syndrome में retention polyps. Please remember, these are some features that you need to remember among the polyps. Then moving further is your GIST. What is GIST, anybody? It is your gastrointestinal stromal tumor. So stroma का tumor है, ना कि epithelium का. Okay, so it is your gastrointestinal stromal tumor. It is the most common mesenchymal GIT tumor. Okay, mesenchyme का most common tumor is your GIST, and it arises from which cells? Very much important. So GIST arises from cells of Kajal, and cells of Kajal are what? Anybody? Cells of Kajal are, I'll move further, you type in the chat box. Most common site for GIST is your stomach. Okay, so most common site of GIST is your stomach, please remember, followed by your small intestine. So GIST most commonly कहाँ होता है? Stomach में, followed by small intestine. कौन से सेल से अराइज करता है? From the cells of Kajal. Yes, good Vaishari. They are known as pacemaker cells of GIT. Please remember. So pacemaker cells of GIT are your cells of Kajal, from which the GIST occurs. GIST starts. Okay. So please remember. Investigation of choice क्या होगा? So remember, investigation of choice for GIST is your CT scan. Investigation of choice for GIST is your CT scan, na ki biopsy. Okay, so please remember, in cases of GIST, the investigation of choice changes. It is not biopsy anymore, it is CT scan. Please remember. Marker is very much important. Patho से भी पूछा जा सकता है. Please remember, marker ये medicine से भी पूछा जा सकता है. So marker of GIST, the most common marker या the most important marker of GIST is your DOG1. Yes, पहले CD117 था, but now the better marker is DOG1. Please remember, the most common or most important marker of GIST is your DOG1, followed by CD117, also known as C-KIT. ठीक है? So CD117 is also known as your C-KIT. So the most common marker which is used, the most important marker which is there, that is DOG1, followed by CD117. Please remember this, important. Then treatment के लिए क्या करोगे? GIST के लिए you just perform a surgical excision, and you also can only one tumor जहाँ पे तुम actually drugs दे सकते हो, that is your tyrosine kinase inhibitors like imatinib. Okay, so please remember, imatinib mesylate is the drug which can be given. So imatinib mesylate can be given in which gastric pathology? It is given in gastrointestinal stromal tumor. Or in which cancers? It can be given in GIST. Please remember this. Okay, then further is your Carney's triad. Okay, what is Carney's triad? So Carney's triad होता है GIST, it is associated with GIST. Okay, so Carney's triad के तीन features क्या क्या है? Question was asked prior. So Carney's triad के तीन features. First is your extraadrenal paraganglioma. So adrenal gland के अलावा कहीं और paraganglioma paraganggliomas are what? You have already seen in ENT maybe, right? You have studied with Sanjay sir, so he might have explained you properly. Extraadrenal paragangliomas, जब ganglion cells affect होते हैं, okay, sympathetic chain वगैरह, so those are known as your paragangliomas. Okay, so first feature of Carney's triad is your extraadrenal paraganglioma. Second is your pulmonary chondroma. And third is your multifocal GIST. So three features of Carney's triad. First is extraadrenal paraganglioma. Second is pulmonary chondroma. And third is multifocal GIST. Please remember this. Now talking about some things. These are some terminologies. मैंने already बताया, अगर दोनों साइड से abnormal communication है, both साइड से अगर communication है, दोनों साइड से cavity है, then वो क्या हो गया? एक fistula. So both sided communication is known as a fistula. अगर one sided communication है, अगर एक साइड से communication है with skin, okay, so एक साइड से cavity, दूसरी साइड से skin surface, then this is known as a sinus. Please remember, एक साइड से cavity, दूसरे साइड से skin, then that would be a sinus. Please remember, दोनों साइड से communication fistula, एक साइड से skin के साथ sinus. Please remember, okay. And अगर one sided communication is with some organ, then that is your diverticula. अगर एक साइड से communication किसी organ के साथ है, like your intestine, ये तुम्हारी intestine है, so एक साइड के communication तुम्हारे organ के साथ है, then that is your diverticula. Please remember, okay. So sinus के बारे में अगर हम बात करें, so there can be a umbilical sinus. Okay, umbilical sinus is due to what? Patent vitreointestinal duct. Okay, so याद रख लेना ये नाम, in vitreointestinal duct. Okay, we'll come across this once again. Okay, so patent vitreointestinal duct can lead to umbilical sinus. Or diverticulum, there is one-sided communication with organ. Diverticulum, either it can be congenital or it can be acquired. So congenital diverticulum are always true diverticulum. Please remember this. All congenital diverticulums are true diverticulums. True मतलब सभी layers होंगे उसमें. Okay, सभी all layers of the wall would be present in them. So congenital diverticulums are true diverticulums. And one example of congenital diverticulum is your Meckel's diverticulum. Very much common question in exams. So most common congenital diverticulum is asked as Meckel's diverticulum. Acquired diverticulum is a false type of diverticulum. Okay, एक या दो layers ही होंगे बस उसमें. So acquired diverticulum is a false diverticulum. And most common site of acquired diverticulum is your sigmoid colon. Most common site, question has been asked. Most common site of acquired diverticula is your sigmoid colon. Most common site of acquired diverticula is your sigmoid colon. And most common congenital is your Meckel's diverticulum. Please remember. Then Hirschsprung's disease. Okay, Hirschsprung's disease is nothing but your congenital megacolon. Okay, so it is your congenital megacolon. Hirschsprung's disease में क्या होता है? There is congenital aganglionosis. मतलब ganglion cell layers इधर भी absent. Okay, so ganglion cells are absent over here in colon. So अगर colon में ganglion cell absent है, it leads to Hirschsprung disease. Esophagus में ganglion cell absent है, it leads to achalasia cardia. Please remember. Okay, so ganglion cells are absent in cases of Hirschsprung disease. It can lead to congenital megacolon. एकदम बड़ी सी ऐसी कोलन हो जाएगी, proximally distended and distally collapsed, ऐसी टाइप की कुछ कोलन हो जाएगी. Okay, the most common site of Hirschsprung's disease, okay, it is your rectosigmoid. ठीक है, remember rectum and sigmoid are the most commonly affected part in cases of Hirschsprung disease. The most common site of Hirschsprung disease is rectosigmoid. Most common site is rectosigmoid. Please remember. Then there would be a long aganglionic segment अगर होगा. So long aganglionic segment है, then the patient would present to us in emergency. And what we perform is your transverse window colostomy. So जो transverse colon होगी उसमें बस एक opening कर देंगे. Okay, we'll perform a colostomy over there. Okay. And then we'll perform, first of all we'll see about the diagnostic method of choice, what we do. So first of all, for diagnosis, mostly Hirschsprung disease would present to us in newborns as well. Okay, so in newborns हमारे पास present करेंगे with the history of not passing stools. Okay, so newborns presenting to us with the history of not passing stools, mostly you can suspect Hirschsprung's disease. You will perform a digital rectal examination. You perform a pearl rectal or digital rectal examination, and once you insert your fingers, there is a flow of stool. Okay, there is a flow of stool coming outside the anal canal. Okay, so this is very much suggestive of Hirschsprung's disease. Please remember. Investigation of choice क्या करोगे तुम? Investigation of choice is your suction rectal biopsy. Please remember. So transmural biopsy अगर option में है तो वो, या फिर suction rectal biopsy, anything can be a better option. So a transmural suction rectal biopsy would be the investigation of choice in cases of Hirschsprung's disease. Please remember. Okay, पूरी एक biopsy निकालोगे और उसमें देखोगे कि ganglion cells are absent. Okay, and investigation of choice to assess the extent, कितना लंबा अगैंग्लियोनिक segment है ये देखना है तुम्हें. Okay, so extent assess करने के लिए you will perform a barium enema. ठीक है, please remember. Then treatment, what you will do apart from a transverse window colostomy which you performed in emergency, now you need to perform a definitive treatment. So this definitive treatment would be your Duhamel's operation, also known as your Swenson's operation. So please remember the name, Duhamel's operation or Swenson's operation. It is nothing but a pull-through operation. So what you perform is you pull up the aganglionic segment. Okay, you pull up the aganglionic segment and tie it around. Okay, so ये ganglionic segment है, ये aganglionic segment है तुम्हारा. So you just pull it up and suture it around the normal ganglionic segment. Okay, so this is a pull-through operation. It is known as Duhamel's operation or Swenson's operation. Please remember. Then next is your Sov and Parkes coloanal anastomosis. Okay, so please remember the names at least. Hirschsprung's disease का treatment of choice is Duhamel's or Swenson's operation, or Sov and Parkes coloanal anastomosis. Please remember. Now talking about the more common question, which is your Meckel's diverticulum. इसमें दो तीन चीजें याद रखने लायक है. Meckel's diverticulum is a type of congenital diverticulum, first thing. Second, it is due to persistence of the intestinal end of the vitelo-intestinal or the omphalomesenteric duct. As I've told you, vitelo-intestinal याद रख लेना. So it is the duct which connects the intestine to the umbilicus. ठीक है. So ये duct होती है in your in your antenatal life. Okay, antenatal life में ये duct होती है, that is known as your vitelo-intestinal duct or omphalomesenteric duct. So if this duct, it normally gets obliterated. Okay, it normally gets obliterated after delivery, but if this persists, if this is patent, then this can lead to your Meckel's diverticulum. Okay, this can lead to your Meckel's diverticulum. Okay, remember the next thing. Meckel's diverticulum is common on which border? It is seen on the anti-mesenteric border. So intestine एक तरफ से mesentery से connected होती है और दूसरी तरफ से Meckel's diverticulum can be seen. So it is seen on the anti-mesenteric border. It is the most common congenital diverticulum as discussed. Then a rule of two is followed. Very important in case of Meckel's. A rule of two is followed in cases of Meckel's diverticulum. So rule of two का मतलब क्या होता है? 2% population would be affected. Okay, so 2% बच्चे affect होते हैं. 2 inch long होता है. Okay, it is around 5 centimeters or 2 inches long. It is 2 centimeter wide. Okay, it is 2 centimeters wide. It is 2 feet proximal to the ileocecal junction. It is 2 feet proximal to your ileocecal junction. And lastly, दो टाइप के एक्टोपिक म्यूकोजा हो गए. ओके, सो इंटेस्टाइनल म्यूकोजा के अलावा दूसरे दो टाइप के म्यूकोजा हो सकते हैं. दैट कैन बी योर गैस्ट्रिक और pancreatic mucosa. If asked which type of ectopic mucosa is common in Meckel's, is your gastric mucosa. ठीक है, कौन से टाइप का ectopic mucosa common है Meckel's में? It is your gastric mucosa followed by your pancreatic mucosa. Please remember. Then most common complication of Meckel's if asked is your bleeding. Question has been asked on this, so please remember. अगर most common complication of Meckel's पूछा गया in children, then that is bleeding. If asked in adults, then that is diverticulitis. In children, the most common complication of Meckel's is bleeding. In adults, it is diverticulitis. Children, it is bleeding. Adults, it is diverticulitis. Okay, please remember. And if Meckel's protrudes in some hernia, okay, so अगर hernia है, कोई indirect inguinal वगैरह hernia है या umbilical hernia है, कोई भी esophageal hernia है, in that if Meckel's diverticulum is the content, then that type of hernia would be known as Litter's hernia. Okay, so if Meckel's diverticulum is the content of any hernia, then that would be known as your Litter's hernia. Please remember. Investigation of choice has been asked for Meckel's diverticulum. So investigation of choice for Meckel's diverticulum is your technetium 99M per technate scan. Investigation of choice for Meckel's is your technetium 99M per technate scan. Investigation of choice for Meckel's is technetium 99M per technate scan. Treatment के लिए क्या perform करोगे? You perform a Meckel's diverticulectomy. If narrow है, अगर छोटा सा है वो, okay, it has a narrow mouth, छोटा सा है एकदम Meckel's diverticulum, you just perform a Meckel's diverticulectomy. But अगर बहुत ज़्यादा बड़ा है, if it is wide, then you perform a resection. Okay, तुम काट दोगे उतना पार्ट इंटेस्टाइन का. You perform a resection with end-to-end anastomosis और फिर जोड़ दोगे ये वाला और ये वाला पार्ट. ठीक है. So if small, you just perform a Meckel's diverticulectomy. If it is broader, then you perform a resection with end-to-end anastomosis. Please remember. Then intussusception. I have already discussed with this with you in pediatrics mainly. So intussusception में क्या होता है? Adjacent part of an intestine, it invaginates into the next part. Okay, so for example, adjacent parts of intestine invaginates into oneself. Okay, so remember, तो ब्रॉडर पार्ट है उसमें एक नैरोअर पार्ट ऑफ इंटेस्टाइन इन्वेजिनेट कर जाएगा, अंदर चला जाएगा उसके. ओके, दिस इज नोन एज इंटरससेप्शन. मोस्ट कॉमन साइट विच अंडरगोज इंटरससेप्शन इज योर इलियोकोलिक. So remember please, okay. So colon जहाँ से start होती है, that is your cecum और ilium, इन दोनों का जो junction होता है, that is the most common site, okay. Iliocecal और ileocolic junction is the most common site of intersusception. Most common site is ileocolic or iliocecal junction, please remember. Then most common cause क्या है intersusception की? It is your hypertrophic Peyer's patches. What are Peyer's patches? These are nothing but your lymphoid deposits. So please remember, lymphoid deposits in ileum is known as your Peyer's patches. So इनकी जब hypertrophy हो जाती है, the ileum will invaginate into the adjacent cecum or the adjacent colon, and this is known as your intersusception. Please remember. Okay. Then most common less common is your colocolic. Okay, less common is your colocolic, and colocolic की most common cause क्या होगी? It is your familial hematomatous polyposis. So जब polyps बन जाएगा colon में, it can invaginate into the adjacent part, and this can lead to a colocolic intersusception. So colocolic intersusception is more common in adults, whereas ileocolic intersusception is more common in children. Please remember this. Then most common clinical features. Most common clinical feature क्या होगा? I have already told you. On palpation, you will feel a sausage-shaped lump. Olive-shaped lump कहाँ मिल रहा था हमें? Anybody? Sausage-shaped lump मिल रहा है हमें intersusception में. Olive-shaped lump was seen in cases of olive-shaped lump was seen in cases of olive-shaped lump was seen in cases of CHPS, that is congenital hypertrophic pyloric stenosis, whereas sausage-shaped lump is seen in cases of intersusception. Please remember, yes. Then sausage-shaped lump is seen. Second feature is your red currant jelly stools. Okay, red currant jelly stools होंगे. Okay, please remember. So पहला क्या था? Palpation पे sausage-shaped lump. Second feature क्या है? Red currant jelly stools almost. Okay. Raspberry stools भी बोला जा सकता है इनको. Okay, please remember. Raspberry stools or red currant jelly stools it would be described as. And then there would be a dance sign. Dance sign is felt on palpation. What is dance sign, anybody? Dance sign is your empty right iliac fossa. Okay, because of invagination there would be an empty right iliac fossa, and this is known as your dance sign. Please remember, dance sign is seen in cases of intersusception. It is nothing but your empty right iliac fossa. Diagnosis के लिए क्या perform करोगे? Diagnosis के लिए you perform a digital rectal examination. Okay, digital rectal examination is performed, but the first investigation that you perform in cases of intersusception is again your ultrasound abdomen. I have told you, first investigation in cases of abdominal pathologies is your ultrasound abdomen. Okay, handy investigation है. On ultrasound abdomen you will see which sign? Target sign or donut sign, also known as bull's eye sign. Please remember, in intersusception on ultrasound abdomen you will see target sign or donut sign or bullseye sign. So this is what is your target or bullseye or donut sign. Please remember. Okay. Target sign, donut sign और bull's eye sign. Surgery में ये signs mostly important है जिससे तुम पता लगा सकते हो. These can be asked also. Please remember. अगर एक्सरे abdomen perform किया जाता है, in X-ray abdomen you can see a meniscus sign or a crescent sign. Remember, meniscus or a crescent sign is seen on X-ray abdomen. So remember, and barium enema पे क्या दिखेगा? Barium enema पे you will see a, so this is your invaginated part. So this, if you perform a barium enema, we can see a claw sign or a coiled spring sign. So this can be seen as your claw, ठीक है? या फिर coiled spring sign would be seen. Please remember. Then, so ultrasound abdomen पे कौन से signs? Bullseye, target या donut sign. Ultrasound पे bullseye, target या donut sign. Okay. X-ray abdomen पे meniscus और crescent sign, half moon shaped. Okay. X-ray पे meniscus और crescent sign, और barium enema पे claw sign और coiled spring sign. Please remember. But the best investigation if asked, okay, I'm not talking about investigation of choice, I'm talking about the best investigation. So best investigation if asked for intersusception is your CECT abdomen. So usually we do not perform CECT abdomen, but the best investigation, your gold standard investigation if asked, it is your CECT abdomen. Okay, usually we perform just ultrasound abdomen and barium enema, please remember. Then treatment is what? Treatment is your pneumostatic reduction or hydrostatic reduction. So air की मदद से या पानी की मदद से you will reduce that. Okay, so ये imaginated part है. Okay, you will just perform a pneumostatic reduction. So this is what is known as pneumostatic reduction, please remember. Okay, and if this pneumostatic reduction or hydrostatic reduction fails, then you perform a surgical reduction. Okay, then you perform a surgery. Then diverticulosis. ओके, सो मल्टीपल डाइवर्टिकुले, बहुत सारे डाइवर्टिकुले अगर हो रहे हैं, अगर इंटेस्टाइन में बहुत सारे डाइवर्टिकुले आर प्रेजेंट, देन दैट कंडीशन इज नोन एज योर डाइवर्टिकुलोसिस. द मोस्ट कॉमन साइट ऑफ डाइवर्टिकुलोसिस इज sigmoid colon. Please remember, most common site of diverticulosis is your sigmoid colon. And कौन सी border? Mesenteric border. So remember, अगर sigmoid colon में diverticula है, it is mostly which type of diverticula? Yes, acquired type of diverticula. And acquired diverticula is common on which border? Mesenteric border. Whereas talking about congenital diverticula, that is your Meckel's diverticulum, it was common on anti-mesenteric border. Please remember. So sigmoid colon में is the most common site of diverticulosis. It is more commonly seen with elderly age group, and the most common cause is constipation. The most common cause is low dietary fiber intake, that can lead to constipation. अगर uncomplicated case है diverticulosis की, okay, uncomplicated, no other abnormalities, no hemodynamic instability, then you just perform a barium enema. Okay, and barium enema पे कौन सा appearance दिखेगा in cases of diverticulosis? You will see a sawtooth appearance. You will see a multiple diverticula will give this a sawtooth appearance, आरी के दांतों जैसा. Okay, so barium enema पे you will see a sawtooth appearance in cases of diverticulosis. Which appearance? Sawtooth appearance in cases of diverticulosis. Please remember. Okay, and then you perform a resection, anastomosis. जो भी affected party you resect it, and then anastomosis of the other resected ends. Then complication क्या हो सकता है? Complication you perform a CT scan. Okay, so CT scan में so complications अगर है, you need to perform a CT scan first to assess, and then you perform a exploratory laparotomy. So complication normally क्या हो सकता है diverticulosis में? There can be a peritonitis. Please remember, there can be diverticulitis which can lead to abscess. Finally it can undergo rupture and it can lead to peritonitis. So to assess peritonitis you need to perform a CT scan, and then you perform a exploratory laparotomy and a peritoneal lavage. You perform a peritoneal lavage, and plus proximal colostomy is done. Okay, so proximal ये पूरे ऑपरेशन को हम क्या बोलेंगे? Hartmann's operation. So please remember, in cases of peritonitis we perform which operation? Hartmann's operation. Okay, please remember, peritonitis में Hartmann's operation is performed. Please remember this. Then moving further, other complications can be your pericolic, मतलब colon के around, या retropper, that is in the retroperitoneal fat. Okay, so there can be pericolic or retropper abscess can be there. Okay, and fistula can also develop, and the most common site of fistula is your colovesical fistula, that is between the colon and your urinary bladder. So the most common type of fistula is your colovesical fistula as a complication of diverticulosis. Please remember. Then talking about